everyone to today's meeting. It's a really important opportunity for us to meet with our personnel partners here today and technical providers and some guest speakers that we're going to have. So my name is Patty Molina. I am Senior Director for Community Health Services with Medical Community Health Center, which serves Santa Cruz County. And I am the co-chair for RAzCHOW along with Lisa Jimenez, who will hear the second part of the venue. The agenda, so we can hear from her. So, Arturo, anything else?
Yeah, I just wanted to introduce myself personally to all the new faces that I'm recognizing right now from virtual meetings and trainings and all of that. So thank you so much again for being here today, for making the time and space and your busy schedules and leave your work at home or in your organization and be here with all of us. And also, I want to mention that it's the very first time that since I joined the network as a director, that I'm seeing the whole network participating in a meeting. So I can't.
And we've got some people online, as you can see, so we do have some virtual partners with us today. So keep that in mind as we speak. We do have the owl there, which does capture the speaker, and then you'll kind of see it flipping around and you'll see that right there.
Yes, and I think it's the time that we can start with formal introductions, short introduction, name and organization that you are representing today. And I think we can start from the back. With our project director.
Great to see you all. I was just like going around the table just saying hi because it's been a while that I have seen some of you. Some of you I have seen like 3 times since I left my home. I did not leave my home, but I've been on the road for almost a month now. But I'm really happy to see you. Thank you for coming to making the time. I think that it's an excellent opportunity for us to come together and talk about CHW, CHRs, promotoras, but also how the network can really strengthen the community. Oh, I just need to introduce myself right now. I'm Flagstaff. I'm the CEO for the RAzCHOW Community Health Workers Association and also the project director for the RAzCHOW.
Perfect. Thank you, Flor. And just to give, to provide to you all a little bit of sense of who we are right now in this table, I'm gonna read through the list of members and the advisory board that we have in our network. And once I mention the organizations, the person who are attending from that organization will introduce themselves. And the virtual attendants, please do the same. Okay, so we're going to start with Arizona Community Health Workers Association, or just introduce herself. We also have Richard.
Yeah, nice to see everyone. Nice to see a lot of familiar faces and a lot of new faces too. Richard Redondo, also with RAzCHOW, and I'm the research and programs manager. So yeah, nice to see you guys all here.
Okay, Cochise County Health and Social Services. They're not in person, but I think I saw a familiar face in the virtual portion of the meeting.
Arturo, can you fix it so we can see the ones online instead of ourselves?
I don't
Okay.
think so. Yeah, Eddie is taking control right now.
Okay, go Eddie.
Yeah, is there anyone from the Cochise County Health and Social Services in the virtual portion of this meeting? Ana Celia Martinez, can you please introduce yourself really quick and let us know if there's something from Cochise?
Hello, everyone. This is Ana Celia Hernandez Martinez, serving as a Deputy Director for RAzCHOW. I wish I was in person, shaking hands and seeing everybody, but I'll be here, I guess, attending from remotely. I don't see among our guests here online if we have someone from Cochise.
Okay. I saw Barb on earlier, but yeah, we can move to to the next organization. Thank you, Anastasia. Brown County, it's Emily Riddle, the virtual portion.
Some members rejoined, they joined the virtual Zoom link at 12, and some of them are still rejoining at 1, so
Okay.
have some missing.
Okay, from CHED, Southeast Arizona Health Education Center.
Oops. Hi, everyone. My name is Brenda Sanchez. I am the current program manager at CHED. I actually want to make a really exciting announcement to RAzCHOW. This is my first time saying it publicly. So as some of you guys know, Gail will be stepping down as executive director. I was just offered the position this Friday, so. At the next RAzCHOW meeting, I will be there as the executive director for CHED. Yeah.
Perfect. We can move to Desert Sonata Community Health Center. It's Sonia or Dr. Daniel Barbara is in the virtual portion. I saw them earlier as well. Okay, and from Chiricahua Community Health Center. Here's Eric.
My name is Erika Vega. I'm the Outreach Community Health Worker Supervisor and we serve Cochise County.
Thank you, Eric. From Mariposa Community Health Center.
Patty Molina, Director of Community Health Services.
Thank you, Patty. From Canyonlands Healthcare.
Hi, everyone. My name is Camilla Adams. I'm a Population Health Director. We have 10 sites throughout Arizona, so in quite a few counties, and we have one in Mesquite, Nevada. So thank you.
Thank you. Camila is the first time that joins an in-person meeting. She's been joining us virtual, but she's joining us now in person. From Circles of Peace, Blanca and yeah.
I am Blanca Costa, Executive Director, Circles of Peace. Nice to meet you all.
I am Rodriguez, Programs Director, Circles of Peace.
Thank you. From Victor Heights organization.
Hi, my name is Alexa Franco. I'm the coordinator of health promoters and activities of the community center.
Hi, my name is Gisela Rueda, Virtual Worker for Winches at High Fellow Organization in Cochise County. Hi, my name is Aida Garcia. I'm President for Winchester Health Organization and promoter too.
Thank you, Aida. From Campesinos Sin Fronteras.
Good morning. Is it good morning? Good afternoon. Yeah, Liliana Cruz with Campesinos Sin Fronteras, Program Manager.
Felicitas Torres, Campesinos Sin Fronteras. I'm Program Coordinator and Admin Manager as well.
Thank you for joining us. From Arizona Advisory Council on Indian Healthcare.
Hi, I'm Allison Lovell. I'm the Business Operations Administrator with the Advisory Council on Indian Healthcare. We're a state agency. And our director just had to step out very quickly, but his name's Dr. John Molina.
Perfect. Thank you, Allison. And from Pinal Hispanic Council. They are virtual. I don't see them.
He emailed that he may not be able to join because they're opening their business, celebrating opening their business site.
Oh, okay.
Said he would try, but might not be able to.
Okay, perfect. Thank you for letting us know, Susan. And from NAU Center for Health and Equity Research.
Yeah, hi everyone, I'm Dulce Jimenez and I'm a senior research coordinator at Northern Arizona University Center for Health Equity Research. I actually live in Tucson and there's also Sam.
Yeah, hi, I work with Dulce. We're here at NAU, so it's so cool that everyone came. And it's cool. Strong word. And I work with Dulce at the Center for Health Equity Research and work as faculty in our public health program here at NAU. So nice to meet everybody.
Perfect, thank you. And we have Dr. Molina joining us back. it's your turn, Dr. Molina, but.
Sure. I'm the director for the Arizona Advisory Council on Indian Healthcare, a state agency. I don't know if we've introduced Allison.
Yes.
You did? Thank you, first time that we've heard, so thank you, muchísimas gracias.
No, thank you for being here, Dr. Molina, and Allison. Welcome. And from Arizona Department of Law Actions, Social Services.
Hi, everyone. My name is Karina Ojeda. I'm the Health Disparities Program Manager for the Arizona Department of Health Services. So I oversee the CHW Voluntary Certification Program at the state level. It's nice to see you all.
And also Arizona Complete Health.
Maria Chaboya with Community Relations for Arizona Complete Health, and I think Anthony's here. Where are you at? There, Anthony.
Anthony Mancini, Community Relations for Arizona Complete Health. I cover most of northern Arizona.
Thank you, welcome. And from the University of Arizona, PRC Prevention Research Center, we have them online. Patty?
Hi, everyone. Katie Ortiz-Pina. I work with the Arizona Prevention Research Center. And I know that Maya and Jill will be joining in and out, but we're kind of tag teaming, so I'm here right now. Happy to be here.
Thank you. Also, we have from Navajo Nation, our friend Majoline.
That's greeted in Navajo Nation, and happy to see all of you. I'm the chapter president of my community. It's part of the Navajo Nation legislative branch. And there's 110 communities on our nation. And I'm the president of one of those communities. So happy to join you.
Thank you.
It's good to see you.
Thank you. And we have Graham County joining us virtual. Emily, can you please introduce yourself? Okay, we can give her another chance. And also we have Tuba City Regional Healthcare Center.
Good afternoon, everybody. My name is Chad Barlow. I'm the lead public health technician for our public health program. We're a fairly new program. We got started during COVID-19. I'll help oversee 14 public health technicians or CHWs in our service unit. We do STI case management, COVID, and soon Hep C and blood pressure reduction. So thank you.
Also from North Country Healthcare Center.
Hello, good morning. I'm Celia Cody. I'm from Navajo, but I work here in Flagstaff with North Country Healthcare. I oversee 5 community health workers. But our agency is pretty much spread across northern Arizona from Lake Havasu, Kingman, all the way across to Holbrook, and then down towards Payson and Round Valley. So we do prenatal care, postnatal care. That's what our CHWs mainly focus on. And welcome to Flagstaff.
And from our virtual attendants, can you please introduce yourself? Michaela Kins, we can start from you.
Hi, good afternoon, everybody. My name is Michaela Keynes. I'm the Executive Project Coordinator for the Arizona Advisory Council on Indian Healthcare. I'm happy to be here. Our council does hold the CHR movement. We facilitate that movement. We're happy to be here and provide any information that comes out to our CHR programs. Thank you.
Thank you, Michaela. Heather Mercy, can you please introduce yourself?
Hi, good afternoon, everybody. I'm Heather Marcy. I'm the Deputy Director of Northland Family Help Center. We're a local nonprofit based in Flagstaff, and we have just begun conversations of what it might look like for our agency to become licensed and certified to have CHWs. So we're brand new and we're excited to join your meeting today. Thank you.
Thank you. Dolly from Tuba City.
Good
Good afternoon, everyone. I'm Dolly Small Canyon. I'm the Community Health Division Chief here at Tuba City Regional. Thank you.
Welcome. Thank you for coming on. Michelle Rocker.
Hi, everyone. My name is Michelle Rucker, and I'm the Director of Human Trafficking Services at Northland Family Help Center here in Flagstaff. And just really excited to learn. Thank you for having us.
Thank you, Michelle, for joining us. Emily, another chance. Emily from Graham County. Are you there? No. Okay. Gwendolyn from Tuba City. I don't see you. Okay, yeah.
Yeah, good afternoon, everybody. This is Gwendolyn Tallman. I am with the Tuba City Regional Healthcare Corporation with the Public Health Department. And thanks for having me. And I'm glad the chat is there in person. Thanks.
Thank you, and also we have two presenters joining us in person. Can you please start, Marley?
Sure. I'm Marley. I live in Tucson, Arizona. I work with Unitas, which is the technology that powers the community cares network here in Arizona. And we'll be telling you more about that in a minute.
Good afternoon, everyone. I'm Dawn Fitzhugh. I work for Contexture. I'm a social determinants of health community program advisor. Thanks for having us.
Thank you for coming. Thank you. We also have our project officer from HRSA, Sachi Khushu. I don't know if I pronounced what your last name, Sachi?
That was great. Thank you so much. Hi, good afternoon, everyone. My name is Sachi Khushu. And as Dr. Luna said, I am the HRSA project officer serving as RAzCHOW on their Rural Health Network Development Grant. I'm sorry that I couldn't be there with you all in person today, but thank you so much for having me virtually, and I'm looking forward to your site visit.
Perfect. Thank you so much. And also we have in person Abdella from the Georgia Health Policy Center. Yeah, and she is our TA, technical assistant.
So hi, everybody. I'm going to do a little introduction after Sachi gives you the whole rundown on what HRSA does. I'm going to give you a shorty, but it's so great to be here. Thank you for being such gracious hosts. And I'm just looking forward to diving in with you over the next day to talk all about social determinants of health and how to make money.
And also from RAzCHOW, we have Eddie Martinez. Can you please introduce yourself, Eddie? He is helping us with everything with the virtual program of this meeting.
Hi, everyone. My name's Eduardo Martinez. Do IT and web support here at RAzCHOW, and it's my absolute pleasure to be helping out today. Nice to meet everyone.
Perfect. Also, we have our consultant, our public health consultant, Susan Kentz, please.
Hi, everybody. I know many of you that are public health consultant in Tucson, and I really enjoy and I'm privileged to be part of RAzCHOW's team providing technical assistance mostly for program development. Thank you.
Thank you. Please let me know if I'm missing someone from the virtual attendance.
Did Barbara come back?
Barb. No, and Sonia and Daniel from the Susanita. No, I don't see them. Okay. Perfect. Well, thank you so much for your introductions and to putting on the table and the environment of work and other things that we have to do this afternoon. And the next item on the agenda, all the Patty Molina, TKT.
All right, so thank you everyone for the introductions and everyone online. I hope that you can hear everything clearly. I know that the owls are great virtual buddies, and so I'm glad that we have them here today. So it's my pleasure to introduce John and Marley. Which one of you is going to go first? I will. Okay, great.
No, one is like change.
Okay.
The agenda has been evolving until the last minute. I'm so sorry for that. We're gonna start with Sachi's introduction and then we can move to the next slide.
He changed the script on
He changed it on.
So sorry, but thank you so much for that.
All right, I am ready to go. I think maybe Eduardo will present the slides. Is that how it's gonna work?
Yes.
Okay. All right, here they are.
Okay, Sachi, all yours.
Okay, thank you. Thank you. This view is okay. We can also do full screen for whoever is controlling the presentation.
We are full screen.
Okay. All right, maybe there's a little bit of a lag. So just a
What are
heads up.
people seeing on? I just remembered. What are people seeing online?
So it may be on presenter view, and it's presenter view.
Gotcha. Do I have control or do you have control?
No, it's the computer's actually there in the conference room.
Okay.
There we go.
Okay, this looks great. Thank you so much.
That's, it's large enough, right?
Okay.
All right. All right, so as I mentioned, I am serving you all as a part of the Rural Health Network Development Program. Next slide, please. And I thought it would be helpful to get an overview of what HRSA is and where the Network Development Program is sort of housed in the Office of Rural Health Policy. Next, please. So the Federal Office of Rural Health Policy has 4 key program activity areas. Those are community-based efforts, where you all are, hospital efforts, policy and research efforts, and rural communities opioid response efforts. So all of these areas are sort of covered in this one office. Next. The overall mission of our office is to collaborate with rural communities and partners in order to support programs like yours that shape policy and that will eventually improve health in rural America. Next. So we do that through cross-agency collaboration, capacity building, and serving as a voice for rural communities at the federal level. Next, please. And in our community-based programs, we do that by identifying community needs, providing that funding, looking at performance and data outcomes throughout a funding cycle, and then going towards that goal of sustainability and then building the rural evidence base. Next, please. So now I want to get into what the Network Development Program does specifically. So the purpose of this program is to, number one, achieve efficiencies with healthcare networks. We want to expand access to, coordinate, and improve the quality of basic healthcare services and associated health outcomes. And finally, strengthen the rural healthcare system as a whole. Next, please. And there are 4 program domains. Those are improving access, expanding capacity and services, enhancing outcomes, and of course, sustainability. And the next slide addresses those in a little more detail. So our FY23 cohort is comprised of 44 awardees. So RAzCHOW went through a very competitive application and selection process to become one of those 44. I had the pleasure of working with RAzCHOW in the previous funding cycle, and now I get to work with them again with Anne, and I'm very happy about that because your team is just fantastic and always operates at such a high level and are so thoughtful and dedicated in everything you do. So it's just been a blast to work with you. So out of those 44 awardees, They are covering 29 states and 1 territory. They focus on things like chronic disease management, behavioral health, primary care, care coordination, and telehealth. Next, please. So what is sort of required in a grant, and how does HRSA work with grantees to sort of achieve their goals? I'm going to talk about that a little bit. So number one, there's the grant recipient, and that's you all. You all are responsible for achieving project goals and doing your activities, ensuring your programmatic and grant compliance, of course, and then managing those federal funds. Then on the program admin side, you have a program coordinator and myself supporting you to achieve your program goals. And I get to have a monthly call with your team to talk through your successes and challenges as you go through the funding cycle. In addition, there's GMS, I forgot the GMS, and they work specifically on the financial piece of the grant. And then last but not least, we have Anne, who is your technical assistance provider, who who is able to work with you at no extra cost. And can you go back, actually?
I'm sorry.
No worries. And she is your point of contact for that technical piece and can provide her wisdom and guidance as you all move through the grant cycle. All right, next. So here's just a snapshot of what the grant cycle looks like for a grantee. There are several deliverables aimed at guiding and sort of honing a grantee's vision into the work that they do. These are things like a strategic plan, an evaluation plan, and even a data dashboard that are meant to serve as tools to guide and sort of focus a grantee's work. All right, next. And if you're curious to know more about HRSA and the kinds of programs it funds, please check out www.hrsa.gov for more information. There's also some social media accounts too, if you want to follow HRSA. And then next. Does anyone have questions for me that I can answer about HRSA or the Office of Rural Health Policy or network development?
If anyone has any questions? No, on the virtual attendance? Okay.
Go ahead, buddy. No, will we have copies of that or that PowerPoint or at least the. Yeah.
Yes.
We can get you the whole deliverable schedule. There's a 4-year schedule.
Okay.
I'm gonna get it for you.
That was my question, so.
Okay. Susan?
Sachi, this is Susan Coons. I was just wondering, we have a lot of tribal representatives here. Are any tribal communities, Rural Health Network grantees right now or tiny grantees?
Yes, Susan, definitely they are represented in the network development cohort. Off the top of my head, I don't know who they are specifically, but I could definitely look into that and get that for you if you would like. But actually, I work with some of the folks in the room on other grants. So HRSA does serve tribal communities across the country, not only with network development, but also with other programs. I'm also the RESEP program coordinator, and I recognize Tanelia Cody. Hey, Tanelia. We also work together, but that's a great question, Susan.
Thank you.
Does anyone has Angeline?
Hi, this is Mageline from the Navajo Nation, and I wanted to know if you are able to share with us the tribal technical advisory work groups contact information. And then how often do you or HRSA sends out or either put aside funding specifically for CHW? Thank you.
Thank you so much for your question. So the network development program in particular is a 4-year program. And it was just competed last year in fiscal year 23. So 4 years from now, in 2027, the program will be competitive again. And at that point, people can apply for network development. In terms of CHW work, there are many grants that CHW work could sort of fall under or be applicable to. And all of that information is on grants.gov. And it's definitely worth taking a look at if your organization is interested. So there basically, like, there are so many different sort of perspectives that someone could take when it comes to CHW work, and many, if not all of those, are represented by HRSA grants.
Thank you, Sachi, and thank you, Najim, for the question. Is there any other question, Ron?
I don't think, maybe you answered my question, but, I'm not sure if I heard it, but, so all of these, large, national organizations such as, CMS and CDC, and I think with HRSA, you have a National Tribal Technical Advisory Work Group. Is there such for HRSA? And if yes, are you able to share that with us? The names and contact. Thank you.
Thank you for asking again. Yeah, I didn't address that part of your question. I can definitely look to see if HRSA has a specific tribal technical advisory board or work group, and then get you their contact info.
Thank you.
Sachi, this is Susan. If I could add real quickly, the National Rural Health Association is, I understand, looking into creating a work group that would specifically have tribal representation so that they begin to serve the tribal governments and tribal communities across the US and Health Equity Council. So I'll try to keep this group apprised of just what I know of a colleague of mine on the Health Equity Council who is from the Laguna Pueblo part next to El Paso. She's spearheading that. So I'll try to hook you all in when that happens.
Thank
but
you.
That's specifically rural focused.
Okay, thank you.
And I'll throw in that I think the Rural Advisory Council that is run by Federal Office of Rural Health Policy has tribal representation, but whether they have a separate one, we can certainly find that out.
Okay.
But we can put you in touch with that group for sure.
Okay, thank you.
Yeah, we have time. Go ahead, Dr. Molina.
Just to tag on to this conversation.
Yeah.
I think where we're trying to get to is that does a HRSA have a tribal advisory group that sort of advises on policy and administrative processes? Because I think where we're getting at is that we're trying to design sort of policy and workflows that HRSA puts out that aligns with tribal priorities, organizations, administrative processes, because the issue has always been the difficulty in being able to administrate and get the technical assistance for tribes. So I think that's kind of what I'm thinking. So is there anything like that with HRSA?
Yeah, so I just did a quick search, and what I found was that HRSA's Office of Intergovernmental and External Affairs, or the IEA, is who leads HRSA's tribal affairs work. So starting with the IEA would be the best point of contact. And I popped their webpage into the chat for your reference. So starting with that branch of HRSA would be best.
Perfect. Thank you, Sachi. And also, I'm gonna make sure to share that information on those resources with the whole audience. Thank you. Does anyone, Brandon?
I just wanted to make a quick comment. I think we didn't highlight that Erika's helping with translation.
Yeah.
I mean, with interpretation. So Erika, if you need us to slow down or you just repeat anything, let us know.
Yeah, thank you so much, Erika, and thank you for the comment. Brandon. Any other questions? Just to close this section with Sachi. Okay, if not, then the next slide is 410.
Okay,
Go.
so Sachi's the federal government. And along with your contract comes technical assistance. And so they contract with the Georgia Health Policy Center at Georgia State University to provide technical assistance. And so I come to you as what they call an external consultant. So there's a team of people who actually are employed by Georgia State University. And then there are some of us that live in the hinterland and provide technical assistance from outside. And I'm one of those outside people. I have been a grantee on a number of federal office rural health policy programs for years when I ran a network in upstate New York, where I still live in a rural community up there. I was just telling Chad earlier, I started my public health career working as a health planner for the Seneca Nation of Indians. So I have some familiarity with IHS and contract health and all of those good things. And I've been working in the space of accountable care, hospital, physician, independent practice association, insurance contracting, and trying to bring healthcare and social care into a clinically integrated space. So that's partly why I have been assigned to your RAzCHOW team, which I will echo what Sachi said. Y'all couldn't be in better hands with the team that you have here. Great, solid on deliverables, very creative. You guys, as the board, as the network members, are working with them constantly on pushing the envelope of this work and helping with a lot of discovery, which is great because all of this work goes back to HRSA, and they put that information into the mill to try and figure out how do we create better equity, how to create better access. And it's really learning from you and the work that you're doing out in the field. So keep up the good work, and we appreciate you. But Georgia, I would be remiss, my bosses would be unhappy if I didn't tell you that they have boatloads of experience doing this. They've been doing this work since 1995. They have provided technical assistance to over 1,500 grantees over that time. And so being, data-driven and science-based, feeding all of those findings into the system, we've really come up with a strategy for what works for trying to move projects to be successful. And network development is one of those. So along with our support, we have a sort of a pattern of things that we follow. And you wanted the schedule of deliverables. Well, your team withers probably when we mention the deliverables because it's constant. We're after strategic plan. Today, we're going to be talking about the evaluation plan and the dashboard. It's a constant stream of activities to develop. But the point is, what we're trying to do is tried and true to try and get you the experience of using best practice tools for what nurtures a network to become sustainable. So while you're sort of in the middle of the storm and it's like, oh, we just did the strategic plan and now you want us to do what? And now we're going to be doing a business plan or a marketing plan or a communication plan or a strategic plan. It's okay. You don't have to get it right. The point is that we're trying to push you and your thinking and your ability to work together collaboratively to get those inputs that are going to make it that much better for the folks in Arizona. So we meet with this group on a monthly basis. We try to mine from those conversations what are areas that we might be able to bring some extra resource to, which is what brings me to tomorrow's presentation about the new physician fee schedule and the ability to bill for some things around community health worker services. We try to, out of that myriad of grantees that are out there, not just the 44 in network development, but out of people who are working in care coordination or outreach or a variety of different areas, find other folks who may be having the same struggles, somebody who's maybe found an answer to an issue that y'all are looking for, and try and create peer learning experiences so that you can talk to other people who are in the field, maybe in a different state, maybe in Arizona. We just connected you guys with Verde Valley not too long ago. They're another network development grantee just down the road from here. So, but we try to provide technical assistance in a variety of different ways to help drive your network at the end of the 4 years toward greater sustainability. Is really the end point of what HRSA is hoping for. At the end of the 4 years, hopefully you learn some skills that you can translate together or independently to other projects that really raise all the boats. So often in rural, we miss out because we're too busy, our heads are down, we're doing 3 jobs. We're too busy to do anything but just survive day in and day out and deliver the service to our people. And what we're trying to do is bring to you what's the state of the art of what's happening so that the big cities don't just get it all and leave us in the dust, that we can bring everybody along. It's part of the equity plan. We'll talk more about that tomorrow, but I'm done.
Thank you, Anne, and thank you, Sachi. Thank you so much. And do you have any questions for Anne right now?
Yeah.
No? If not, then we can move to the next item in the agenda, right, Patty?
Yes, so now I can introduce Dawn and Marley. Dawn, you're gonna go first.
Well, we're together, we're
Right.
together,
But
we're duo.
Okay.
We're together and we're trying to fix that issue to be able to, see the whole screen.
I think I might be able to do it because I'm presenting from here, and if we get this down,
Okay.
I think it actually might fix it.
Okay. You can pay your off.
Oh, yeah, she's listening on.
Oh,
And
Yeah. So there you go.
can the people online see that?
Yes, yeah.
Well, hello, everyone. I'm Dawn Fitzhugh again, from Contexture. I just want to say, Sachi, you did an excellent job presenting. I enjoyed listening to you. And then I have Marley here with me, who is from Unitas, and that's the technology side. Before we dive right in, just out of curiosity, because as we introduced ourselves around the room, I'm curious if any of you have already either have had some type of conversations about community cares or is already part of community cares. And if you want to just raise your hand so that we can get some feel of the room of who's in the room.
So service of peace of Morales.
Yes, yeah, they're on the platform. And okay, so this kind of just helps me understand like how deep to dive in. So community cares program is something that Contexture is one of our programs. I started with Contexture almost a year ago, but I joined using their advanced healthcare directed registry. So I was on the Choose Your Person campaign and have just transitioned into community cares, where we are focusing on addressing social determinants of health. Marley's going to be able to give you a demonstration, and I want to give more time so you can see what the platform looks like, so you can get an idea of potential data that you might be able to capture using the platform, how easy it is to receive a referral and to send a referral, to really wrap around the social determinants of health. And then lastly, we'll go into next steps. It's a super easy process. If that's something you're interested in, or you know of some partners that might be interested in joining the community cares program. Okay. So as I said, community cares really was brought to us by Access, and it was launched with the Whole Person Care Initiative back in 2019. And really it came from the fact that our healthcare providers were identifying that, you know, an individual it's more than just giving a medication, it's more than, but really that we need to focus in on all social determinants of health. Every area that might be impacting a person's health and well-being. And so, again, if you think through it and if we're addressing the social determinants of health and someone has high blood pressure and you're like, okay, well, here's medication, good luck. Well, that's not gonna help them if they're potentially going to lose their house. They don't know when their next meal is. There's so many other factors that could affect a person, individual's well-being. So we came together and really started to kind of clue into the data piece or tool, and that's where we get community cares. And it is going to be that kind of connector, that closed loop, because you know, you might give a referral or hand someone a business card and say, good luck, I hope you get those services, but you never know, did they really get what they needed? But this tool allows you to understand whether or not that person has gotten connected with the care. Marley, you want to kind of add in a little more?
Jump in. So these two slides are kind of about like the partnerships, right, that are helping to build the community cares network. So we've got Dawn with Contexture over here, and then I'm representing the Unitas side of things. So Unitas is a national technology software platform that is really aimed at creating a referral network specifically to address these social care type of referrals. So that's just a little bit about us.
And then here's where we get into it, the partnership of what really creates community care. So Access being the funder, Contexture was the recipient because we are the healthcare information exchange for the state of Arizona. We're also that for Colorado. Collaborated and partnered with Unitas for the technology piece with community cares. And then Solari and 211, they already had some type of resource that the community or any individual can get on and access. But what this does is it brings it all, so now our organizations can talk to one another and really have those communication behind the scenes. Go ahead, if you want to add.
Yeah, well, I'm actually just curious, how many of you in the room have used 211? At all? Okay, only a few people. All right. So if you don't know about 211, I always do like to just let people know that that is, you know, our resource and referral directory here in Arizona. And we, like Dawn was saying, we've already been able to ingest into the platform over 3,500 of their resources, which means that even if we haven't worked with the organization specifically yet to onboard them onto our network, the resource is still available in the platform. And so when I go to the demo, I'll kind of show you all what that means. That might feel a little confusing right now. So just to add that.
Okay, and so the like, what are the benefits of community cares? What can it do? And being new to community cares, kind of seeing the impacts that it has, I really see it as something that kind of streamlines processes that you're already doing with the referral and capturing data. It allows that closed loop, that connection, that data tracking, you know, potential opportunities for grant writing or for other accessibility options that you can gain access to through utilizing the platform. And this one is hard to see, but what it basically is, okay, yes, sounds like one more thing, but if you're already doing it, and then this allows some incentives for your organization for joining the platform. So just by signing the community cares agreement, saying, yes, I want to participate in the community cares platform, you can receive $1,000. And there are other milestones that if your organization meets, you get additional incentives for participating, for accepting referrals, And then also there's technology reimbursement opportunities that you can have through the platform. And then with the data tracking and access paying attention to, the metrics, we have identified that housing and food insecurities are the largest in Arizona, that the greatest need. So access it would increase the incentives for those organizations. So now they can even gain more incentives. And who knows, as more we're onboarding, the more organizations that are starting to participate, the lapse of gaps of different areas and needs that we have, the more incentives that we can do to help increase that need and make those services.
And I'll just add a little bit to this. So I know on this page, it doesn't tell you, but also in the middle of your table, we put out some flyers about community cares, and specifically there's an incentive page. So if you want this information that talks about these milestones, you can grab that. And I know we didn't add it up here, but so it's $17,000 that an organization can earn to come onto the network. If you're food or housing, it's $25,000. That you can earn to come onto the network, and it's all, that's unrestricted funding, right? Other than the technology reimbursement, right? That piece is for technology, but beyond that, it's unrestricted funding. And then just going off what Dawn was saying too, about those milestones, I just want to emphasize a few things. Generally for our partners, when they first come onto the platform with those milestones, you're receiving either $4,000 or $6,000 just to go live on the platform. Because those first 3 milestones have to do just with going through the onboarding process, which you do with me. And so, and a lot of people choose to take $6,000 when they first come onto the network, because $2,000 of that is also to train your staff, and that can come out of your technology reimbursement piece. And just a couple more pieces about the milestone too, is like, we really wanted to emphasize that we understand that the network might bring more referrals to your partners, right? And to the agencies that you work with. So being able to provide this funding is important for that reason, but then also just, it takes time, right? It takes time and energy to come onto a new network and platform. And so trying to just provide something to be able to compensate for that. That's kind of why we have these extra incentives here in Arizona that we're trying to offer to organizations. So if anyone has questions about these, happy to, either one of us are happy to answer those at the end.
So again, like I was saying, as more people are utilizing the platform itself, we're able to see the volumes that are being serviced, and we can also do this for all of Arizona. We can do it specifically by the different counties and the different communities to see what is the greatest need. We were on a road show and went up to Kingman, and when we just kind of looked at Kingman in general, one of their greatest service types that they were receiving and sending referrals for was for youth and recreational sports right now. And you think about it, it's the summer, and children are out, and those are services that they're needing. So many times it is food and housing, but again, all services that could address or impact an individual can be addressed through our community cares platform. And then this kind of gives you an idea of some of the achievements, some of the things that are happening in Arizona when it comes to the number of resources, the number of organizations that are live on the platform, to the number of referrals that are being sent out. If you want to add more, feel free to.
Yeah, I mean, people always ask me, so like the network really started to build, I would say, really only as of like a little bit over a year ago, kind of quickly. And so we do have like the majority of organizations are still kind of concentrated, right, in Pima and Maricopa counties, but we are really making a concerted effort at this point to try to reach more rural communities. We've been up here in Flagstaff. I was just down in Nogales. We have been working with folks in Bisbee, Cochise County, you were just out in Kingman.
Yeah.
Anyway, so
yeah, and I think one it's a lot easier for us to onboard our healthcare providers because through Access, there's staff and incentives. And then we really are needing the support to reaching the community and sharing with the community what community cares is and the value behind this tool. In order to get more organizations onto the platform so that it can be used the way it was intended.
Well, and based on a conversation I was actually having at the back of the room earlier, just so folks know, like in more rural communities, for example, organizations that can join the network that we would love to see on are schools, churches, libraries, like all sorts of organizations that you might not immediately think of, you know, that's not, maybe not a nonprofit or not, you know, a health organization per se, but that absolutely are interacting with people, helping to be a hub for community needs, right? And so they're absolutely able to be a part of this network and platform as well.
Yeah, and so here are some current network partners that we have. So some of them might look familiar. It also gives you an idea to what Marley was just saying, and like, yes, nonprofits, yes, government, yes, schools, programs, food banks, they can all be partners on the platform that we can send and receive referrals to.
Yeah, and I always like to say, it's like, if you work with people, you're probably a good match for the platform, right? Because anywhere there's people, there's needs. And if we want to get people connected, this is for, even though we were talking about how Access is the funder, this is for everyone in Arizona, right? Trying to get every person to have better health outcomes and be more holistically healthy.
Yeah, because you don't necessarily need to have access to be able to get these resources. If I identified a need with my children, I could go to a partner and have them send a referral on my behalf.
Okay, so this is kind of where I take over.
Thank you,
The
Marley.
presentation more, because basically now, so we've given you a little bit of background, right, on the network. And now I'm the technology side of things. So I'm gonna talk a little bit more about like, what does this referral network actually look like? And just for folks in the back, hablo español, entonces si ustedes quieren hablar conmigo después o algo así, está bueno. So,
Thank you.
yeah.
Gracias.
So, okay, so just starting here, on the network side of things, like as Dawn was mentioning, one of the things that you can do through using this network is really to capture better what your organizations actually are able to provide to the community. And so this piece is kind of talking about how not only on the platform you have access to export some of the data about referrals, all of the services that you're providing and connecting people to in the community. But then when your organization has sent or received up to 5 referrals, you actually gain access to a Tableau dashboard called our Insights dashboard. And that's where you can actually start to see some of the larger trends, like in your community, in your county, you know, where are you fitting in? Where might there be a lack of resources, for example? And so
Excuse me, Marty, how many referrals you just said?
just 5.
5.
Yeah, because basically in order to have a data platform that can tell you something, you need to have some data.
Yeah.
So that's why we have to have just a little bit of data to first get you started on this piece at least. So, yeah. Also, I'm happy to stop along the way and take questions. So I will stop at certain points and just see if anyone has questions. Okay. The next piece, privacy and security is really important on our platform. Definitely always want to emphasize that, right? Because a lot of the people that we're working with are working with sensitive information, right? So first, we never share client data without consent. So when referrals are sent or received in the platform, there is a one-time consent that when you're working with a client, you have to garner that before anything can be sent. That is able to be garnered in over 50 different languages at this point and in 6 different ways. So we're trying to provide a lot of different like methods for folks to be able to have that consent, but the consent piece is really important, right? We also protect clients' sensitive information. So what that means is that in the platform, for example, we have these things called sensitive services. So if you do HIV/AIDS, legal services, substance use, mental health, domestic violence, I think there might be one more. Those are considered sensitive services.
Probably sexual assault.
Yes, yeah, those types of organizations, absolutely. Those are considered sensitive services, and they have even higher levels of security on the platform in that only the direct providers working with that client are able to see what has happened in that referral. And even the sending provider, like what we call the non-sensitive organization, they'll be able to see that that person got connected for resources, but they won't be able to click in and see the case notes, necessarily that you see as a part of the outcomes. And again, this will probably make more sense when I show you in the demo platform, but just trying to show you all that we take it really seriously, that sensitive information. And so we have that piece that we do. On top of that, we also make sure that your users, right? This is a provider to provider platform. So as you add users to the platform for your organization, they can have different levels of access. So you have org admins that are your highest level of access. They can change your program information, they can add users, they can take away users, etc. They kind of have all the access all the way down to, we have 6 levels of access. So we have someone who can just be a network user, it's called. And so they just have access in the platform to basically be able to see the resources, but not the client information that's in the platform. And then there's different levels in between. Finally, we're HIPAA compliant, FERPA compliant, 42 CFR Part 2. So if anyone's particularly interested or concerned about privacy, I do have a privacy and security packet that I can send to folks as well. Okay, I'm gonna pause there because I'm gonna transition over now to the demo piece. But while I'm doing that, does anyone have questions?
Also from the virtual participants.
I have a question. Those other, like, you mentioned like schools and churches and libraries, do they also like, would they also be able to like get the milestones?
Yes. Yeah, they're accepting those referrals. And like, churches that say they're doing a bank.
Yeah.
And then, you're able to send a referral for that, individual to that church to receive those services. And then they're meeting those milestones and they can, receive, and they just have to have their tax ID number.
This is actually a good opportunity. Okay, a couple more things about the incentives that I didn't mention. Okay, so to receive the incentive, an organization does have to be able to receive in referrals for a service. Sometimes this can be an issue for schools because they're mostly sending organizations. They're not often like receiving. So we do love working with schools, but there have been some complications around them wanting to receive the incentives, but not being able to necessarily accept referrals into their, programs because that's not kind of the way they work. So just that quick note. The other thing that I didn't mention before is like, the milestones that are after you onboard, have to do with the amount of time and usage on the platform. So after 6 months, if you're responding to referrals within 4 business days, you get a disbursement of $3,000. And after 12 months, if you're still using the platform and responding to referrals within 4 business days, that's when you get a $5,000 disbursement. So those are kind of the other milestones that go along with it that I forgot to mention. And note this because I want to make sure you all know, we do actually ask for a standard of responding to referrals on the platform within 2 business days. Now, that doesn't mean you have to serve that person within 2 business days, right? It's just saying, like, taking a look at the referral and seeing if you might be able to accept or reject that. But the reason our platform standard is 2 business days because we have a real person, right, on the other end of that referral. They're waiting for services, they're in need. So we do ask and encourage and have as our network standard that is what we ask our organizations to try to hold to. The reason the incentive is based around 4 days is is to be a little flexible for you all, right? To try to allow people to be able to hit those milestones. And that's the way that we're able to pull data, on that side.
And as you're logging in, just an example of the school district, Creighton School District, they have a community resource center. And so that's who is receiving referrals, because they have like a food bank, that they're doing at their school for their community.
Yeah, sometimes schools can receive, it just depends on, but. Any other questions or,
So for services or either resources that we can't provide, can we refer them to you? And is self-referral allowed?
Those are great questions. So part of it is if an organization has, that's one of the main for community cares, if you get someone and they have a need that your organization can't provide that to them, you're able to utilize the closed loop referral system to send them to another organization. That it is organization to organization, but there is a feature that individuals can self-refer, but I believe that's to your own organization. And so I might need some clarity there.
Yeah, let me talk a little bit. So what a self-referral in the platform is something that we call an AR form that we can set up for each organization. Assistance request form is what it stands for. And my partners will put that on their website generally. And so what it is that then a person that's looking for that service, right, of that organization, and they want to be able to access that, can self-refer into that organization through the assistance request form. But like Dawn was saying, it's going to refer into your organization. Now, if they need a service that's outside of your organization, then you could always use the network to get them connected out for that other referral. Yeah. Okay, great questions. Yeah, go ahead.
Yeah, I had a question on the privacy part.
Yeah.
Among tribal communities, that's a very critical issue
Yes.
with tribal data. So I was just thinking, in developing this partnership, we talked something about a privacy agreement. Is that something like a business associates agreement to meet HIPAA standards? Because you've got a lot of players.
Yeah.
And I'm just kind of wondering, who's a hub for that information to be maintain their privacy according to HIPAA privacy standards?
I guess that's kind of both of our organizations, but so, to come onto the network, you do have to sign what's called the community cares agreement first. And a lot of that agreement has to do with where is the data gonna be housed, what's happening with it, and so that is like a really big step of onboarding, is that agreement, and then, what was the other part of the question? I just really lost it.
I'll add, like, maybe you're thinking of it, because Contexture is the high trust, but we're the healthcare information exchange. And we have healthcare providers on your definitely sensitive information. We have a team, our implementation team, that works directly with tribal communities. And so they would be the ones that would help with onboarding and ensuring compliance and ensuring the security of that information. Where Marley and I, we're more on the community-based organization side. Our sole focus outreach is to really connect with community-based organizations and helping them to get on the platform. And this would allow healthcare providers to connect with them. And then when they receive those needs that they're unable to service, they can connect with other organizations.
I did remember, you asked about BAAs.
Yeah.
So when we work with certain organizations that have, that have sensitive information, we do ask for a BAA. Now that's up to the organization, we offer that to the organization. If they choose not to sign or don't want to participate in a BAA, they don't have to. But that is something that on the United side, we will offer to organizations with sensitive services as well. Yeah. But I forgot. Okay, go ahead.
One more quick question. Do y'all currently manage clinical closed loop referrals to CBOs?
Yes, because we use them. Okay, sorry.
No, go for it. I remember I'm not 1 year in, and I'm still working on 2 teams right now, so I'm learning.
Yeah.
This is my first time presenting in person. And like presenting solo, so thank you guys. And
You're doing great.
thank you, I appreciate it. So go ahead, Marley.
Yeah, okay, so yes, the answer is yes, and that's like a huge piece of the platform, right, is we've got healthcare providers on, we've got the CBOs, this is trying to create
Yes,
communication.
and you've already done that.
Yes, it's
So
already
that's-
happening. for
That's
sure.
good to know, because there's a lot of talk about it in other states,
Yeah.
but it hasn't been a reality. So,
It is the reality of the platform, so, okay, I'm gonna jump into the demo. What you all are seeing right here, this is unitus.com, this is our website, it's a web-based platform. So you can take this out into the community, like if you have an iPad or you have your phone. You can use this platform and network on the go as long as you have internet. Right? So I just wanted to show folks, if you were gonna come, if you were a user, you've worked with me, you come onto the platform, you would come here, you click login. Then you would put in your email and your password that you had chosen, and then you would be put into the Unitus platform. So this is your first glimpse into what the actual technology platform looks like. Now, a few disclaimers, this is the demo platform. And so none of this information in here is real, right? Privacy and security, so we're just working with not real data. There are pieces where, because it's the demo platform, we don't have a ton of organizations like put into here. So I'll show you when, you know, when normally you would be able to see a lot of organizations pop up. In the demo platform, you'll only see a few things like that. But what I wanted to show you all right now is when we first come into this platform, right? I'm gonna be demoing as a gentleman here named Joe Garcia today, so I'm now Joe. And I am demoing as a food pantry, so I'm with the Grand Canyon State Food Pantry. And what I'm gonna walk through right now, I think we have time, is to go through what it looks like for an organization who's accepting referrals. To accept an incoming referral into my organization. So I first want to show you all that. And then what we're going to do is, you know, what so often happens when we're serving the community. I've worked in nonprofits my whole life before this position, so this is a very common thing, right? Someone comes in for your services, and then they start talking to you about other needs that they have, right? So then what we're gonna do is we're gonna go ahead and use that same person that we accepted into our organization to then send out a referral on their behalf to get them connected to other services in the community that they're needing. So I will show you those kind of two core processes on the platform. And then if we have time, which I hope we do, I will show you some of these other tabs, like how you can export data from the platform, how you can use the My Network tab, how you can make changes and updates to your programs. And I think that will be everything. So, yes.
Okay, question, and forgive me because I'm completely lost now. The Unitus, is that just an example of an organization that's on the Community Cares Program platform that can take referrals, or is the Unitus the actual Community Cares platform?
We're a technology company, we create this platform, we're the software piece of this. So if there's ever like updates to this, or our users are telling us that something's not working on the referral network, right? That's what Unitus does.
So that doesn't answer my question though. Is that then the actual Community Cares platform where everything gets connected then, or no?
Yes.
So
Yes, so
once you sign up, you're gonna see these. So you need to go through here to see the referrals and all of that. Exactly. Once you sign up and onboard with me, this is what you would have access to.
So this is Community Cares, and we utilize Unite Us. Almost like if you think, because in my mind, this reminds me of my inbox, so Microsoft, or, you know, that's the technology piece. And then all the referrals are coming in and out through the Unitus platform, which is Community Cares.
Why, okay, why do they have two different names, just out of curiosity?
Because Community Cares is the program itself for that Access is paying for, and Contexture. And then we contracted with Unitus to build the dashboard, or to build the platform.
Okay, thank you, got it.
Yeah, and it's Community Cares is kind of like a partnership, right, of multiple organizations and whatnot, so that yeah, it can get a little confusing. Okay.
Marty, are you presenting a video or with audio? All of that?
No, I'm
Okay.
through video.
I just wanted to make sure for the.
Okay, yeah, no, I'll just be going through now, so, okay, so when you come to the platform, like Don was saying, it does kind of look like your email inbox now, right? And we've tried to make it that way, to make it, very user friendly. So on the left-hand side, you'll see kind of these matrix sections and subsections underneath. Anytime you come into the platform as a user and you're accepting referrals into your organization, you'll be put into your inbound referrals that need action, right? So those are inbound referrals coming to you where someone's needing something. And you want to take a look at those to see if you can accept or you know, you might need to reject them from your organization. So what I'm first gonna do is I can see right here, under my needs action section, I've got this little 4, and I don't know about you all, but I'm a very visual person. So I'm like, okay, I've got 4 referrals in my inbox that I need to take a look at. I'm in my inbox right now, right? So I can see all 4 of those referrals sitting here. So I'm gonna go ahead and click into just this first referral at the top here. And now I'm gonna walk you all through how I would look at a referral to see if I could accept this into my organization. So the person looking for the services, right, is John Martin. This yellow bar across the top is indicating that it still needs action, right? So I haven't done anything with this referral yet. So then what I do, I go ahead and I look at what organization is sending this to me, right? So in this case, it's an organization called Desert Finance. And there's a sending user associated with it. So Mickey Mansell here works at Desert Finance and has been working with John Martin, right? And is sending this referral over to me as Joe Garcia. So this is really helpful, at least in my mind, because we're connecting person to person, right? That's actually serving this one client. So then I go down to the service type. And in this case, they're looking for emergency food. Your organization might have multiple service types, right? So it's just important to check with what they're looking for. And then finally, I would go down to this referral description. And so we just got a really quick, you know, John needs food for 3 days until he gets paid, right? And I'm like, okay, I'm a food pantry. This is enough information for my organization to say, yes, I can go ahead and serve this person. So what I'm gonna do is now I'm gonna go down to this take action button here. And I'm not gonna walk through, we don't really have time to go through all of these different options that you can have to respond to a referral. So we're just gonna go ahead and say for now that we're gonna accept this referral into our organization. So when we go to accept a referral, we choose the program first that we want to accept it into, because again, your organization might have multiple programs, right, on the platform. So in this case, I just have the food pantry program, so I'm accepting it into that. I've already got the service type, because I know he's looking for emergency food. And then I choose a primary worker. Now, this is kind of an important piece because I'm going to keep it as myself for now, as Joe. But this is where your organization, you can assign out to another person this case, which means that then, you know, if I chose Andrew right here, Andrew would be the person that would actually be reaching out to this person and, you know, calling them, emailing, whatever that might look like to get them connected for the food box, right? So that's why I choose a primary worker there. And then I'll just leave the case open for today. I'll click save. So now we've moved on the left-hand side down into our internal cases that are open. And I can see this green bar now, right across the top, it says open. So I know that this is an active case in my organization. So now what would be happening, right? We're doing a little bit of a time jump. Let's say that we called John, we got him, you know, into the organization quickly. He was able to come and get that food box. So now this is when I would come back in to this case. So like, let's say, you know, I come back in, I'm in my inbound needs action, but I really wanted to come back and close that case, right? So I go back to my open internal cases, click on John. And now I'm gonna want to close this case right here. So the first question that asks is it resolved, right? Was this need resolved? And we were able to provide the services, so I'm gonna say yes. And then it asks for the outcome, and so I'm gonna say that we did, we provided those services. And then it asks for a quick note, so let's say client received a food box or 2 weeks, something like that. And then we go ahead and close that case. So now what has happened, right, is we've captured that outcome not only for our own organization to be able to say who we served, but my buddy, Mickey Mansell over at Desert Finance, right, also just got a notification when I closed that case about what happened. And so he also knows, right, that John got connected for those services. So both organizations are privy to the outcome, right? And they don't have to do any, calling of each other or anything like that to know what happened in that case. And that's the beauty of a closed loop system. Okay, questions there on accepting a referral into your organization?
Remind me, because I don't specifically work with this, but I know that there's a connection between this and the EHR.
Yeah. So for organizations that have an EHR, we do have integrations with a number of EHR systems, Epic. What's that?
Next.
Yeah, so that would be something that our implementation team would work with that specific organization to basically offer that integration.
Right.
Yeah.
Do you have a situation where you have to do multiple resolution in terms of referral to different agencies?
2 different outcomes.
No, one problem, but you have to use 2 resources to resolve that issue.
Yeah, so I think what you're talking about, they have capacity to send multiple referrals. So when you, for that individual, and so as you send multiple referrals, you're able to see when they're being closed. So you're gonna get notification when they've gotten taken care of from that organization, and let's say it was food and transportation, you're able to see that those needs were being met for both services for that one person. Yeah.
Okay.
And the submission will be just one referral for both services.
I'll show you
Okay.
that when we go to send out the referral. Yeah, these are great questions.
Do you provide like a demographic reports to all the agencies for what they have referred or submitted into this platform?
So, great question again. So, demographic information is an interesting one because we don't actually require you to put in demographic information on the platform. That's one thing I'll say. I do encourage organizations to take the time to do that because it can benefit your own organization and the network health, the network insights that we're able to show. So that is a piece of our insights platform that I was kind of mentioning earlier on the slide, is once you get access into insights, you can look more into that demographic piece that if you're tracking in your organization, you can take a look at that on the insights platform.
So we can be available from there. It's like for grant writing or anything.
Yes, exactly. That's exactly
This is a
right.
perfect tool to support.
Yes.
As well.
People absolutely do that. It's a huge way that the data from the platform is used.
But I'm sorry, is there any specific place in the referral system to enter the demographic?
Yeah.
If it's not required.
So, so I'm not gonna show you all today what it looks like to add a client on the platform, but let me just show you real quick. This is a great question to segue me into the next case. So I'm going back into John Martin's case, right, that we just closed. And then I'm gonna go to what's called his space sheet, because on the United platform, this is where when you create a client, all of their information lives. Now, if I go to their profile tab here, this is where contact information, personal information, demographics, etc. It all lives here. If you ever want to, come in and make updates to that or changes, you can add that here to a person's space sheet. So, so if you need to add that information or you want to add that information, you can do that at any time.
Thanks.
Yeah. So this is a great segue. So I'm already kind of showing you all the face sheet here. Just so that you all are familiar, you can see up top here, that consent piece that I was talking about. We've already created John in the system, right? His consent has been accepted, but that's really important because in order to send out a referral, I do need to make sure that I have that consent, that all looks good. I have some contact information here, and that's also really important. Because to send out a referral, I want to make sure that I, can contact that person. Yeah.
And how do you get the consent from the patient? You need to have like something in paper, or
There's multiple ways. So there's multiple ways. If you all are interested in seeing that, is everyone interested in seeing consent? Okay, I'm seeing some nods. I'm gonna show you really quick what that looks like. So I'm creating a client. I'm just gonna not belabor it real quick. The information that you need in the platform to create a client is just first name, last name, date of birth. So I just searched for duplicates, but what I'm gonna do is skip all this and just go to the consent piece. Okay, so when I created a client, there was all that demographic information, et cetera, that I can input, but then the next step is informed consent. So 6 different ways to garner consent. We have digital ways, so you can send a text message, you can do an email, or you can do on-screen consent, right? So if you have like an iPad, you can just hand them the iPad and sign it. We also have paper, right? So they can do a wet signature, you can upload that. You can do an audio file. So we have a consent script, you can record that, them giving their consent, you upload the audio file. And of course, as I mentioned, these can be in over 50 different languages, right? You can see that right here. You can choose the language that you're sending this consent script in. Finally, there's user attestation. So that's on screen by attestation, which means, and I'll show you what this actually looks like because this is the one we usually use here. I, as the provider, would be reading out this script to the person. They would say, yes, 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 I agree, right? You read this whole script. And then as long as they've agreed to everything, then I, as the provider, Joe Garcia, right, would sign my name. I always do a really good job. This is kind of a version though of what this consent script looks like. It's not super long, it's not super complicated, but we do have to have it.
And it's one time.
Yes.
You don't have to get it every time. So once you get that one time and they're on the platform, you can send and do referrals for that individual until they say, you know what, I no longer want to be a part of it, and then they can take out their consent.
Right. So now I've created a new face sheet, right, on the platform for Young. And this is where I would start sending out referrals. But I want to go back to John.
Question?
Yes.
Is this available without internet, or what happens if like you're in a community or in an instance where you don't have internet access? How does the platform work?
That's a great question. So it is a web-based platform, so you do have to have access to the internet to be able to use it. That being said, part of that technology reimbursement is trying to get internet potentially to people that don't have it, right? So part of the technology reimbursement, we can pay for your internet, we can pay for those hotspots, yeah, like things like that, because we understand that that's a necessary component of the technology piece to get on the platform. We do provide that as a part of the reimbursement.
Does that also include technology itself, like
Yes,
iPads?
yes, yeah, so a lot of people use it for computers, iPads, whatever that you need to like be able to use a network like this, paying for your internet service, paying for your phone service, right? If you're reaching out to clients, you can use it wherever you best need that technology reimbursement. Cool. Okay, let's go ahead and send out a referral now for John. I feel like there's been a lot of questions kind of surrounding the outbound referrals, so hopefully I can address all of those for you. So let's say that John came in, right? And we were giving him that food box, and that as we were talking with John, as so often happens, he started telling us that he had lost his job, he was having a really hard time finding a new job. he was kind of like, maybe I need help, finding a new job. So I'm hearing something there. I'm like, oh, maybe he needs some job training or placement, something like that. And then we talked to him more and he finally admits, well, actually, the real reason I've been having a really hard time is because I've been struggling with my mental health and I've been depressed. And so I haven't even been able to, do what I need to do to find a job. So again, another thing there that I'm like, oh, maybe you need a referral on the platform for mental health services. So I would go ahead and ask that person, right? Would you like to be referred on the platform? And if they say yes, then we can go ahead and send out a referral on behalf of John. So we're gonna go ahead and do that now. So in the top right-hand corner of everyone's face sheet, we have this refer out button. So I'm gonna go ahead and click on that. And the first piece on a referral out that is always going to be asked is the overarching service type first. And when my partners come onto the platform, I always recommend that you kind of try to become familiarized with the different service types. But really, we've tried to make it easy where you can just do a keyword search, right? So I'm going to go ahead and do a referral for that, that mental health. I'm going to type in counseling. And so as I type that in, I can see under mental and behavioral health, all these different types of counseling that come up, right? So I'm going to go ahead and choose individual counseling. And then from there, once I've chosen that parent service type, I actually am going to choose a program that specifically is going to work well for John. And in order to do that, I'm going to open the advanced search. And okay, this is the part where we don't have a ton of organizations input into the demo platform, right? So we're only seeing a few resources pop up here. But when I come into this advanced search, actually the first thing that I always recommend that you do is you go to this filters button on the top here. Because this search is really going to be able to get you someone connected in a way for a service that's actually going to work for them. And you can do that in different ways, right? So from someone's face sheet, there are 3 pieces that will automatically pull into the filters. That's if they put an address, their age, and their gender. Right here, you can see that this person didn't add an address to the platform. They just have their gender and age. So it's going to specifically show programs that are able to serve someone of his age and of his gender, right? If I want to add residency address, I can right here. But another piece that I want to show you, I think this is so important. Let's say John is justice involved. And he's been having a really hard time finding organizations that serve people with a justice involved background. We can come here and make sure that when we put that justice involved population, that the programs that pop up are going to be able to serve him, right? So this piece is really important, and we can put in all of these different types of populations that we can make sure a program serves. Then this accessibility tab is also really awesome, right? Let's say that John only speaks Spanish and he needs a program that's going to be able to have someone that can help serve him in Spanish, right? I can come into this language piece, find Spanish, and then only programs will show that have someone that's able to serve that person in the language of their choice.
Are we able to send referrals for patients without insurance, or that if they are, like I have one question from Winchester High, if they don't have papers to be here, like if they are not citizens or residents?
Yeah, so the platform doesn't ask anything about citizen status. We do have, I believe, under population. Right, we have immigrants and refugees. We also do ask each organization when they join the platform if they are able to serve folks who are undocumented. And so we definitely have that consideration on the platform. And make sure that, we're trying to get people connected to programs, again, that can actually serve them there. And then as far as insurance, you asked about, under payment options here, you can see that there's different payment options. So like, let's say that there's someone doesn't have anything, like, that they're not going to be able to afford anything, they don't have insurance. I can put free here and I can make sure to find a program that's going to serve that person, right? So lots of different ways that you can get really granular on connecting a person to the right services. I'm gonna clear the filters right now because they exited out all my programs. But so now what I want to show you, right? Like, let's say that we've done all of our filters, we've got those all properly done. Now I'm gonna look at the resources that are actually popping up that are available here. So I'm just gonna click into this first program. And what I do when I click into a program is I read the program description and I look to see if there's any eligibility requirements, right? So this program description, it's not very comprehensive, looks like it'll work for John, so that's great. Eligibility requirements, luckily for this organization, it's just that the person needs to live in the state of Arizona, and that's easy, right? So John lives in the state of Arizona, so we're good. I'm looking at some of these other things, like let's say that John, you know, is able to self-pay at this point. So I'm gonna go ahead and add this program now. Let's say that this is a good program for John. I added that in the top right hand corner. Now I'm gonna close out of that advanced search. That program has populated here. Okay, to address some of the questions about can I send multiple referrals as like one referral? If I saw another program that was a really good fit for John too, right? On top of that mental health program, I can add that program here too. What will happen is it will send out what's called a batch referral, which means that whichever organization accepts that referral first, it will recall the referral from the other organization, right? Because the idea is that you sent out the same service type referral. So you don't want that person to necessarily get connected for two individual counseling centers, right? You just want one of them to take it. So when one accepts it, the other one recalls. Now, if I was gonna, I'm just gonna scroll down. If I wanted to add another referral for that piece that I was talking about with the job placement, I would go ahead and just add another one. I don't know if you all saw that. I added another referral in the bottom right-hand corner. Then I would just go through that same process that I was showing you all, right? Go through the service type, add the program, and then I would scroll down and be able to send that all out as a part of one process, right? So that's kind of nice. I'm not gonna do the whole second referral right now. I'm gonna delete it. So let me just complete this one referral. We want to write a brief client description, right? So let's say client is struggling with mental health and counseling. You know, there's not a lot that you can put there. I'm going to go ahead and click next. Then we have a assessment that comes up. You don't have to fill this out if you don't have time. We recommend that you do if you have time, because it'll often allow your client to be better served by the organization you're sending to, but I'm going to skip it for now. And now we're at our final step of sending out a referral, where we're just reviewing the information, making sure that contact information is there. We've got that mental health program through Healthy Minds. It all looks good. So I'm going to go ahead and say confirm and submit. And now I can see that referral has been sent out on behalf of John to Healthy Minds. And I'll bring your attention to this column that says status, because these are old referrals that I've sent out right here, right, for other people. And I just want to show you, right, like here, I can see the status of the referral. So I'm the sending organization. I can see this one was recalled. I can see this one was accepted. This one was accepted, right? So again, it's that closed loop piece where I'm able to still see what's happening for my client, even when I send them out to another organization. Okay. Did I cover everything people wanted to see in the sending of a referral? Okay, that's great. Okay, I feel like I've taken a lot of time, so I just want to run through a couple other things really fast, and then I'm gonna be done. So exports real quick. This is where you can come in actually on the platform. You can create a new export. There's all sorts of different types. So like, let's say you want to see the referrals that you sent for the last year. You can do that, right? You can pull your certain date range. We have all sorts of, you know, different types of data that you can pull from the platform, and that'll come in a Excel file that you can then download. Then just real quick, the My Network tab. This is a wonderful place to start in the platform. If you've just gone live on the network, into the My Network tab is going to show you who is live on the network in your area, you know, what organizations are there. You can also do something like I do this all the time where I'm like, oh, I wonder what organizations are doing clothing services in my area, right? And so I can look through those different service types and see the organizations that are available. I can see in-network and out-of-network organizations. Now, that's the piece that I was talking about with 211, right? Out-of-network organizations on here are going to be ones that aren't live on the platform, but you can still see that service.
You can still refer to it.
Right, you can still refer out. And this My Network tab could be for someone, like, let's say they don't want to provide their consent on the platform. Or let's say they maybe need like a lower touch type of referral, like they're really excited to reach out to the other organization. They just need to know which organization it is. They don't want that closed loop piece. I could come on here. Let me clear my bird. So if I come into this, I don't want that organization. Let's do that. So if I come into this organization, I can actually add this program right here. And then right here in the top of right hand corner, I can share that program directly with that person via text, email. I can print it out and hand it to them, right? And again, this can be in over 50 different languages that I can share that resource with that person directly. About all the different resources in their community, right? So there's different ways in which we can use this My Network tab to connect people for resources as well. Okay.
Is that a website, can you do it you can have it in Spanish?
So the platform is not in Spanish, but you can send a referral to someone in Spanish. Yes, like you could share the resource in Spanish. Yeah. Yeah.
Yes, I've been out of the room, but Blanca and Eva, you're the only ones I think that said you were using this. Have you shared with people how you're using it?
No, we're gonna start.
Okay, cool.
And America also uses it.
You guys use it too? Okay.
It's our folks with referral system.
The only challenge I have found is that there's not many providers in the community using it. So when you want to refer out for medical, mental, sometimes you need to be out to someone or other places because no guidance. I think it's just big providers too.
So you and Mariposa and.
I haven't seen Mariposa, I have seen Pinar, but probably I haven't searched the web.
But now Hispanic Council.
Pinar is using it, and that's. If I could remember any other provider. No. We're getting a lot of referrals from outside, from Tucson, from Cochise County, so we're accepting those and referring back to other providers, close to the address of the person who's looking, searching for services. Is that we are lacking providers.
Yeah.
Utilize that.
Patty, so when you say closed, how are you guys using it?
So with the when we're getting the referrals from either emergency room or other types of social services. And so then we have our meeting with Contexture tomorrow or our population health department does, because that's their ones who handle the majority of that use it. So yeah.
I was curious, it sounds like it's been up and running. I know there was a previous company and there were transitions. And so you all have, I think Contexture's been going for at least a year now, right?
Yeah.
What is your data telling you in terms of your closed loop referral rate in the communities that are most saturated, say? Like, are you seeing, and are you hearing anything, like, how are you monitoring how organizations are feeling versus, because I'm thinking about Circles of Peace and it's a wonderful platform. It's extremely important. And I'm just so curious, like how are people getting burnt out? Those folks that are new, that are early adopters, or how are you all, what are you feeling? What are you hearing? What's your data telling?
Yeah, that's a great question. I know on our end, That's one reason why Contexture has program advisors. And so both on the implementation side, that they'll support the healthcare providers if they're not meeting milestones, and they'll have connections with them. We've created certain groups and pilot programs to really like focus and tune in on increasing partners and providers to join the network. And then on the CBO side, we've increased the amount of program advisors as well, also to provide TA and technical assistance, or if there's capacity issues or new staff coming on with training and onboarding. So it really gives that personal touch of like giving you the technical assistance that you need. And then as we're growing, making those connections to other organizations so that we can share with them, inform them on the usage of this and the power behind this tool and the best practices that it brings to increase the overall program in itself.
No, it's wonderful. And I mean, just coming from a rural area in this region, like I want to support this as much as possible because it's a lot of labor to do. I mean, what you're able to do in seconds is hours of labor. And I think the labor is so essential in building the trust of the person in the beginning to be able to navigate them emotionally, navigate them. I mean, the labor can be spent in different ways versus like this just, you know, it can help. But I was just curious how to support that uptake and it's meeting people where they're at, providing all that technical assistance and all that stuff. It sounds like that's what you all are trying to provide, those wraparound services to make it easy for people to adopt. Yeah.
Well, and just to build on that too, that, you know, we love to hear from people, like from our partners who are already on the platform about, like, for example, I work with a lot of community organizations where the network is only as good as, you know, it being useful for you having the providers you need on the platform, right? And so a huge way that we can get more people on the network is when you, as a provider on the network, want to see someone on, you know, that you send referrals to, let us know, you know, or give a warm email handoff and be like, hey, we're using this platform. I want to introduce you to Marley. Like, she would love to talk to you more about it. Like, those types of connections are often really powerful, or onboarding as a cohort, especially potentially in rural areas, especially because of this issue of not having the right organizations. If you get like 8 of your rural organizations together, you know, or even like 3 or 4 that can refer to each other, you know, I can do groups of onboarding cohorts where, you know, it can be more useful for organizations, you know, that are trying to really start building those networks in some of our like less populated areas. But yeah, it's a great question. Anything else on the demo piece, on the network?
Oh, go ahead.
Yeah, I just had a question, maybe tied into this. This is a lot of data. And I think from a public health perspective, it can be very useful in policy. Does Unitas keep all this data, and if they do, would it be available to academic center for future research? Is that something that would help drive a lot of public policy, I see?
Yeah, so I do know, for your first question, we don't sell any of the data to like third parties or anything like that. So yes, like Unitas is just the hub of the data for the platform. I haven't had that question before, so I would have to check on you know, utilization of the network data for research. But I'm happy to get back to you on that.
Does anyone from the virtual attendance has any questions?
I'll look in the chat.
I was just gonna say, for like a deeper dive, we regularly do community information sessions that we can share, and you can link in and sign on to kind of explore. You get the first half again, but then you get to see another demo, or we're happy to present and do more intimate one-on-one sessions to really dive in deeper to the different functions that the platform can do.
Yeah, and Dawn,
Oh, sorry, just one question, like, what is the start to the finish? Like, how long does it take an organization? Like, what's your average, being live, going live? Just,
I
just
think
so
I'm probably the
people.
one to answer that. It really depends on your organization. I mean, I know that's like probably a frustrating answer. I could have an organization, if you're really excited about it, I could probably get you through the onboarding process in a week.
Okay.
And then it takes up about 3 weeks to actually build you on the network right now. So about a month if someone's like super excited.
Okay.
I would say though, for many organizations, especially my nonprofit partners, people are busy, things are coming up, it gets pushed back. So it can sometimes be like a month that it takes to get through the onboarding plus that time to go live. So I can be working with a partner for 2 to 3 months sometimes throughout that onboarding process to get them live. It just depends on how fast you want to move.
Yeah, I mean, it really is a simple onboarding with the community cares agreement. And having that signed and then the PRF. And then the building of the organization, and then there's training, like virtual little tool training on how to use it. We provide some personal training as well, and then there's that chat function where it's 24 hours, right?
Yeah.
So,
Yeah, there's a lot, we try to provide a lot of support on the network, so that you don't ever feel like, I don't know what's going on here, right? There's a lot of different ways to get help and support when you're actually using the platform. So definitely, provide that support. And then just going back to the onboarding process, like that's kind of the final piece actually of our presentation is just letting you all know. So the next steps to coming onto the network really are, and I don't know, Arturo, like, if we can get connected, but usually I'll send out to everyone who's seen this presentation a connection so that you can sign the CCA, the Community Cares Agreement, if you want. And then move on to that partner registration form. That would be with me. Your partner registration form is all the information about your organization that basically will be listed on the platform, right? So all of those organizations that you were seeing with their description, their eligibility, et cetera, it's making sure that your program has all that information correct in the platform and that people are going to be able to find you for the services that you provide. So we would work together. That it usually takes about an hour to fill out together. And once you get that in, that's when that 3-week period starts to build you out on the platform, and then you go live. And you can get that training at any point between, the build and go live. And even when you are live, you can continue to get training on the platform.
And Marley and Donna, you guys gonna stick around today?
I'm gonna stick around for a little longer.
Yeah.
And I have business cards. I also brought some treats. Well, they're stressful. Really now, you're in the next few days. And then I brought 3 water bottles.
Okay, we have 3 water bottles, and so these are going to be given out based on, to see if anyone has the answer to the question. Okay, so I just came up with these randomly, but so for those of you who are listening, what are the top 2 service types in Arizona right now? The top 2 needs the platform. Does anyone remember? Yeah.
Food assistance and housing.
Correct. I would, Okay. Does anyone remember the United standard for how many days you ask that you take to respond to a referral? 2? Okay, I think that's on the back here. So, yeah, 2. 4 is for the incentive. 2 is anybody willing to share, you can either use the platform or not, would anyone be willing to share a few sentences about how you could see your organization or organizations you work with benefit from using the platform, or how they might be able to use the platform?
I can share, but it's gonna be a share with a question.
Okay.
I think that, how I see it, and we're working with Alex. Contexture. I don't know, my question was, are you working with Alex? Contexture, I think you are already.
Dawn especially works with Alex.
Okay, yeah, so
He's there, yeah.
yeah, and as it is actually working right now, meeting with Alex. To be, ASHA will be becoming a hub for CHWs, and actually I do see how ASHA can actually be that person, that organization that can actually be representing the CHW workers, but also providing the support and information at community level that organizations are gonna be needing besides the support that you're giving, because I was in the meeting last time that you were having with our Maricopa folks. There was a small group and I was part of that, so I'm really interested to learn more about that. But I do see how ASHA can actually support the organizations at state level, that especially the communities and grassroots organizations.
You get the last one? And online, if you want me to come out, I'll bring you something too.
Sure.
So what we're gonna do is, we know that this presentation went over, and so what we're gonna do is go ahead and take a 10-minute break to allow you either to use the restroom, get some coffee, some refreshment, and then we're gonna come back. So Dulce will take over, and then we can proceed with the evaluation.
Thank you for your time.
Very good presentation.
You guys are doing, I apologize. I just don't know from like everybody. It sounds like you need to do a CHR with that screen. So I was wondering if you but he's an OBGYN. And things that we're trying to do is for use by us, HRs, or do you guys have any questions with our partner? Oh, really? Yeah. So, healthy what? I know, right? Yeah, because one of the things we're trying to do is want to make sure that the materials are budgeted at it, because like our staff is our agency, our staff is so like we have twice the diverse group with different areas of expertise. You know, and then steps, is that also ADHS?
No.
Okay, awesome, thank you.
Here's my info.
Oh, let me take it, I'll give you the card back, because I'm going over.
So you
You think I would remember I was well, they actually someone else last night. And then I
To travel.
You're what?
You told me.
I'm gonna tell you.
December 21st. I just.
No. I think I was about 35.
I'm pretty sure that's the link.
Oh, 80. Is that?
Hay como 5 variedades de galletas.
All wrong. I had all wrong.
Vamos a presentar la propuesta. Ya terminamos.
So I guess.
Because if it was later, actually, if it was on the 28th, I could probably do August. Could you?
Yeah. Oh, August 28th.
Do August 28th.
Yeah.
I'll make the note. Yeah, okay, so let me.
Yeah, whenever.
2025, right?
28th to 28th in person. You have 33.
Awesome.
They just said, we're gonna try to find out, like,
Do you have a card? I sure do. May I? I don't have a card, but I can. I'll send you an email.
Yes. Perfect, thank you so much.
Awesome, thank you.
I had no idea that Navajo had, what did you say, 110 communities.
Yeah.
That's a huge Congress just in and of itself.
Yeah,
Are
so,
you sort of like a county executive, if you will, for your population?
right, yeah. So we're like the size of West Virginia, the state?
Yeah,
Yeah. So we're-
your area.
Mhm. Yeah, the whole Navajo Nation.
Wow.
And it goes into Arizona, New Mexico, a little bit into Utah.
Oh, yeah. Yeah.
Okay.
How many, what's the population? Or is it sort of equally divided like Congress would be?
It's a little bit over 400,000.
Total.
Yeah,
How about
total.
your area you represent?
Somewhere around there.
Yeah.
Yeah, but we have some of our members that have moved off into municipal or metropolitan areas. And then they, for school or either employment, but they come back.
Wow. So do you have a seat on, and the only thing I have to refer to is like my work with the Seneca, do you sit like on a tribal council? Or do you have a hierarchy that represents you?
Probably right under the tribal council. So the 100 or 110 chapters, they're divided into 5 regions again.
Gotcha.
So I'm on one of the regions. And I'm the president for a sub division of that region. Yeah, so stay busy with it.
Yeah, I bet you do. Oh my
Yeah.
God. Well, thank you for your service though, because not everybody's interested in stepping up into a leadership role.
I know,
As wacky
so,
as politics are these
yeah,
days everywhere.
so this year is our election year for tribal offices. There's a president, vice, and secretary. A lot of the communities, they have only solo candidates. So I'm one of those, like, running unopposed.
Oh,
Yeah.
good for you. That means they think you're untouchable. You're
I don't
doing
know.
such a good job.
Oh, thank you.
That's great. And where do you actually live? What
It's
part of
about
the state?
half hour north, a little bit to the east.
Okay.
Yeah. And he's lucky, he's only, what, 60 miles from here? No.
About 80. Yeah, 280 miles north of Flagstaff.
Yeah.
Big state. It's so interesting to me being, from the east, everything's just littler and more concentrated. And we have 62 counties in New York that are, include the 5 boroughs of the city, so Manhattan, and all that. But then, all the rest are out there, and our county is the largest county in the state. It's about just over 1,000 square miles, and here you have 15 in an enormous state, and your counties are like 10 times that size. Jesus, years ago, what was it, 10,000 square miles?
Yeah.
And I tell people that, I don't even know the state of Imagine that infrastructure.
Yeah.
Everybody has a little county supervisor or whatever, and just the logistics of,
Yeah.
why would you put that to manage such a small district? Everybody's got their thing.
Committees so that we can help share this information. And so it's just, you don't have to be like a partner for us to come out and present the information or of the organization. I think there was just like, this would be amazing for them. Then you feel free to just share. Because the no cost. Yeah. Some of those are, they're kind of returning us. And those people. It's a little.
Yes.
No, that sounds right. That sounds great. Yes, we got community cares, we have the person and all of these things are just amazing things for us of our organization. Impact really cares. Well, I think. And that's what we. Right. I know there's a lot of information, so it's
Are you, are you the same person that comes to Envision?
Envision? No, that's Gwen and Jamie. Yeah, it's Gwen and Jamie.
So you didn't go to the summit in Spokane?
Oh, I was there. I was one, yeah, I was one of the big ones that one. Yeah.
Did you guys also mention it?
Yeah, so next August, yeah. Next August, so, yeah.
Congratulations. No sabía que tenía. I didn't know.
Thank you.
Yeah, congratulations.
I wasn't sure if I was
Well
allowed to
deserved.
share, so
Yeah, well
I
deserved.
asked.
Yeah, very happy.
Thank you. Gracias. See, and I knew you when you were barely an intern, when you offered me a position, and yes.
Yeah.
Yes. It's a full circle.
Cookies at?
I kind of did the same thing either. So I was at the lower threshold of service delivery manager. And then there was a reservation-wide CHR director for the Navajo Nation that opened. Then somebody said, oh, we should give it a try. And I looked at the job description. I've had some experience in education. But I wasn't sure myself. And when I had applied, I said, I'll just challenge, see if I get it or not. Yeah, and I got in. Yeah, but there's two. So what the Department of Health Director did, what she did was, she got all of the CHR supervisors, and they interviewed me. Right away, I could sense two individuals. Then they want me to succeed. But I just put it aside and just did my best. I got hired.
Yeah, I went through 3 rounds of interviews. And I think as the more interviews passed, the more nervous I got. And okay, so there's another one, and here's another.
Yeah.
It worked out in the end.
So where's your office?
Nogales.
Nogales? And then Flora has a house there?
I think that's a house in I know Richard lives in Tucson, so she stays with him in Tucson.
Just one more.
I thought she had a house in Nogales.
Not that I'm aware of. No. Unless it's a secret. Maybe. Wait, but does your daughter go to NEU or ASU?
Yes.
Neither. I have a daughter at the U of A. The U of A.
Then I send you the virtual file to go.
They have a free tuition, right?
They have a free tuition? Where?
U of A, undergraduate. Only for undergraduate.
No.
My
We're
son,
paying an arm and a leg.
yeah, my son just got admitted there, so. And then I kind of heard about it, but he confirmed. Check into it.
Okay, start coming back together. I think we didn't have the eval plan.
Yeah, but, yeah. For the virtual attendance, also we're gonna share this.
You're gonna go to that, okay.
That part.
Oh, okay.
Thanks, everyone. I hope you all got some refreshments. Did y'all see there was cookies and chips and suds outside, coffee and all the good stuff. So the next part of the afternoon, I'm Dulce. I think we already established that, but just to recap, I'm a co-chair of HRSA. The next part of the afternoon, we're gonna dive into the network evaluation plan. So we're gonna review together our mission and vision. Our leader's gonna walk us through our mission and vision. And then like just a really quick recap of our strategic plan, and then we're gonna go into an evaluation activity together. We're gonna have you all split up into probably like 4 groups, and we have some questions here for you all related to RAzCHOW or to RAzCHOW evaluation that we want to cover. And we also have a separate breakout room for the virtual group so that they can be a part of that as well. So I'm gonna let Abdella take over here. He's gonna present to us, like I mentioned, the mission and vision and a little recap of our strategic plan, what I do.
Yeah, thank you so much, Dulce. And we think that it's always needed to be on top of our mission and vision, to refresh that vision and mission for all of us, and to keep moving forward with our network goals and all the work that we're doing with RAzCHOW. So vision, I'm gonna call the door just for the noise. Friendly reminder, vision is RAzCHOW will be united and recognize HW workforce throughout rural Arizona. So we're agree with that vision, still good and up to continue for RAzCHOW. And our mission is that our network will be a sustained, diverse, driving force for the CHW workforce in Arizona to improve access to healthcare, health outcomes, and quality of life for rural Arizonans. So everything is, I'm not asking to move or to update or edit our mission or vision, but just wanted to make sure that we are all on the same page and this is still updated and current. And just also a friendly reminder that I know that we already made introductions, but these are our members. There are 14, and these are the advisory board that we have. And also for the people that are joining us today as collaborators and partners. Thank you so much again for being here, because we're not just meeting today. This is an ongoing effort for us to maintain up to date. And when I did the presentations of RAzCHOW with your organizations, I got really good feedback and really good willingness to participate in the future as collaborators. So thank you again for being here. And I just wanted to remind that this map is something that we added in our updated strategic plan that we submitted as a deliverable this past March 2024. And this talks about the triple aim of our network. That is the CHW capacity, the health system capacity, and the financing part of the network. And how the CHW workforce will contribute to the triple aim, improving population health, improving patient care quality and satisfaction, and reducing costs. Just friendly reminder, I know that you all have the document, you all participated in putting all this together, but it's always good to refresh and get land again. And also sharing about the strategic plan, and I'm sharing about the strategic plan because the next activity is going to be the evaluation plan in data dashboard that we just submitted a couple of weeks ago. So for that, we have to take in consideration the strategic plan that we made as a network, and the subcommittee that we formed, and the contributions that we have within the whole network. So just a reminder and refresher, we came together as the first primary focus area is system change. And system change, we are implementing strategies or objectives to promote the voluntary certification, to maximize Medicaid access and Medicare reimbursement, as well as a value-based reimbursement for rural Arizona and for the rural CHW workforce. Okay, and we just had in our previous quarterly meeting, the training from Julie Smithwick that came from South Dakota and gave us a really good walkthrough the reimbursement and making sure that we understood and could manage all the information that she provided to the network. So the second one is program expansion and improvement, and we all agree that this is for increase the CHW workforce in Northern Arizona, where we are now. Provide core competency and topical trainings for CHW, and it will be depending on the organizational needs that we are assessing at the same time. Meeting the needs of especially underserved populations, build the CHW administrative capacity, develop a plan to attract youth in CHW career, and this particularly attract me a lot because I remember that you, Brenda, came up with this specific point back in December 2023. And also to build a model for CHW behavioral health integration. So for the third one, the leadership development and recognition, we decided that we have to retain the CHW workforce through fair and competitive compensation and work through that. Prepare CHWs for leadership roles and develop a CHW/CHR recognition plan. Also, this is this will be for the sustainability of the programs to rural Arizona. And number 4 is partnerships and collaborations, strengthening the existing partners and members and building new relationships. That's why we took in consideration that we had to make the reintroduction of the network to existing members that they weren't participating or they weren't very active during the last year, 2022, 2023. So I think we did great. Now we are all together, and also we are building new relationships with, for example, to the city, North Country, and the other organizations that are here. And last, the emerging issues. This was also very attractive for all of us during our December's meeting because we haven't talked, or the network haven't thought about that until last year, to be thinking about how can we integrate the CHWs, our workforce of CHWs, in the emergency preparedness and response within our communities. And also to have like subcommittee or a committee designed to do and make policy analysis and advocacy for our workforce as well. So any questions so far? It's just a refresh of our strategic plan and our goals. Now, we wanted to share with you all that we recently submitted the evaluation plan and data dashboard. This was one of our deliverables for this year, for the past year, right? And for 2023-2024, ending on May.
Yeah. June.
May or June, yeah. Thank you.
You remember better.
Yeah. Yeah, and since we didn't engage a lot with the network, with the whole network, building the evaluation work plan, we want to get the feedback and the activity that we're going to make to have right now. It will be towards the evaluation work plan that we just submitted, because it is important for the network to be involved, to participate, to get their feedback, your feedback, and then if the evaluation plan is a live document that we can continuously make modifications and do different things with that for our net. So just as a concept is, the evaluation plan is used to clarify how program activities will be assessed and monitored, as well as how the results will be used to make program improvements and demonstrate impact in our community. Because at the end of the day, we want to create that impact in our community, improve population health, have more CHLs in rural areas, the goals that we have as a network. Also, this evaluation plan has to include evaluation questions, indicators for measurements, data collection and communication strategies, timelines and costs, for us to be aware and be mindful of the time and the goals that we have as a network, as RAzCHOW, and be proactive in deciding what subcommittee is next, what do we need to do next, and constantly be in communication with our technical system and our HRSA project officer to get assistance as well. So in the more, in, for me, and I think for all, the most important thing about the evaluation plan is that it's a living document. It may be revised over the time to reflect changes in the network, and we can make improvement, edits, and plan our activities with ahead of time. So within the deliverable of the evaluation plan, we submitted this chart. This is just an example with one question, and it's how this activity today is going to run. For example, we have here the RAzCHOW goal to promote and sustain the territory workers in rural Arizona. But then we have evaluation questions that can reflect how we can measure those goals as a network and what's the timeline and all of that I just mentioned it before. So for example, question 1, I don't know if this has left, but I don't think so. Were RAzCHOW members satisfied with the network functions and activities? That was something probably to the network itself, just to evaluate the network efforts, the engagement, the participation, and how members are feeling. And we recently, or not that recently, but at the beginning of the year, we completed the wider surveys. So, I'm sorry, before that, the indicator for that specific question will be individual network member response. And the data source of or instrument will be the wider survey that you all, or the majority of you completed. The method, it will be electronic completion. The target population is all network members. The timeline, we decided as a network that we will be assessing RAzCHOW every 4 months. And the responsible or who's leading the co-chairs and me as a network director. So this is just an example of how we incorporated our question process and other questions within the evaluation work plan. Okay, and we can go more deep in the next activity. Okay, for that, we want to share as well that the evaluation questions should focus on both process and outcome evaluation. And this is to provide the primary evaluation, including those that focus on both implementation, that are the process question, and the impact of the program or the impact of our activities in the community. Those are the outcome questions. The process question focus on the program's operations and seek to better understand how a program is being implemented. For example, were program activities completed as originally intended? This is a process question example. And the outcome question. The outcome question focuses on showing whether or not the service achieves the desired changes for the patients, for the providers, or for the community. And an example will be, how did participant knowledge change as a result of the diabetes management classes? And this is not from our network, not from RAzCHOW, but from the directions and the guidelines that we got from person. So just for us to think about the process and outcome questions that we have to complete. So for this, I don't know if you have any questions so far about the evaluation questions that we were going to review, or any particular idea, because we're going to move forward to the activity itself, and we're going to make groups of discussion to mostly to get your feedback as network members and collaborators about the work that is done and the deliverable that is already submitted. We stated within our submission that we didn't get the feedback of the whole network before submission, but that we were planning and willing to get the feedback. So that's why this is huge, and it's important for us to complete and to review it as a network. Okay. So I don't know if you have any question. If not, I think those can help us with that group.
We wanted you to all kind of like split up, because I think we've all been sitting also in the same places. So we're gonna split up into 4 groups, and I think Eddie's gonna put the fifth group online in their own breakout session. But I just wanna like go back to, elementary school, middle school, so we're just gonna count off. Go ahead.
Could one group be Spanish speaking only?
Oh, yeah, that's,
Yeah, I think that would be best.
Yeah,
Yeah.
yeah,
They could-
definitely.
Yeah.
The other three could come off.
Yeah.
I think that would work best.
Okay, yeah, so if y'all wanna, anyone who's like Spanish speaking, cause there's 27 of us, you said, right?
27
Yeah,
in this room.
so it'll be, we were doing 4 groups, it'll be about 6 to 7 people per group, so. Whoever's Spanish speaking, if y'all wanna, huddle together. that
And we're
way.
staying in this room?
Yeah,
Everybody
Yeah.
together?
yeah,
Mhm.
I think you can find it.
But you can, yeah.
Find like little pockets or whatever.
Also,
Yeah.
we're gonna share the big posters just in case you wanna, if there's something specific and write down ideas or feedback. And, yeah,
So we're just gonna count 1, 2, 3, and we're just gonna go around and then the Spanish group can do together, so if you wanna kick us off?
2.
4.
No.
Wait, 1.
Yeah.
then back to you.
2.
2. Two.
You too.
I'm 3.
Ajá.
Español?
Español.
Okay, muy bien. Para el equipo español. Then, then Dr. Molina, so 1.
Too many.
Dr. Molina, so 1.
1, yeah.
2.
3.
1. 2.
Well, how about Eva? Eva?
You're the next number.
Like 3,
3.
okay. And Susan? Or
1.
1, okay.
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 I think we're going to take photos.
Yeah.
So if you want, like, maybe we can have all the ones like huddled in this corner, here our 1 leader. And then we can have. Yeah, and we'll take the 2 outside, yeah.
Would you like
Where are you taking us? In fact, right downstairs, there's a couch area.
Okay, we'll put it on
Right
there.
downstairs, yeah.
They can stick to the wall, so you can. Like,
Sure they
Over there?
they're fixed. The white.
Yeah. But I think it's- so those of you that That's the handout.
Oh, yes, yeah.
Yeah, you do need the questions.
And then we're gonna be doing the evaluation. Work plan as well.
For your master.
Okay. Get some fresh air.
Sure, have a seat here.
So here is your plugin.
Right back. I think we're gonna.
I think it's also yes. Yeah.
Yeah.
Those are the questions. Which one is those? And people can say, now I gotta go pick up my kids. Oh, okay. Yeah. So you can use this. Oh, okay. No, we're not answering, just, for example, for RAzCHOW activities carried out as planned. Like, giving the feedback if the question is correct, and what do you want to understand about, how will that knowledge be useful for the network, for the evolution program itself? You know what I mean? No?
So it's about what you wanna assess or evaluate and how to do it, not giving the answers right now, but are we asking the right question?
So helping
Okay.
you to get the correct question,
Yes, it's not giving answers like, oh, the network is.
just to
good or
review
bad.
the question and see if
Yeah.
we can do it in another way, or it's
We're
just.
trying to get, and maybe there's a better or additional question. Yeah.
I'm gonna spread the message to the whole.
So.
Ahora en español.
So are the members of
Yes, I think that would be the first question, like, do people even know what the activities?
That's a really good question.
Student art members aware of what the activities were supposed to be.
I think. Anthony, they're looking for a photo and things, the guy from here.
Yeah, they've done very much. Yeah. Whenever I write, I'm gonna, she's so neat.
Yeah, they're doing everyone always sees person too. But spelling is sometimes the best.
That's such a good question. Okay, I'll put it, even know what the activities are, which is what gets put in the grant application and then what's in the strategic plan. And it's really hard to keep up. And we have quite a few members of the city union that just joined the last year to 6 months. And so they don't have as much history as the network, that's really the question. The network started in 2018, there was a one-year planning grant, and there's a 3-year. This is the second 3-year grant, so this is officially like the beginning of the 5th year curve, so, yeah, it was smaller and it's grown.
And I think also through the past few years, there's been multiple directors of it, so then.
He's the 5th.
Yes, and so each of them have had a different, as somebody who's been here since 2013, like.
Or maybe he's the 4th, there was
I think it's
Betsy,
the 4th.
Linda, Ben, Blanca for a short time.
Yes,
He's the
it's the
4th.
fourth.
He's the 4th.
They all have different styles
Yes.
of sharing information with the network, and then there's gaps in between. I mean, there's been stuff that has kind of just.
Maybe just make a note, something about, network turnover and network director, maintenance care, and effective communications, is that kind of what?
Yeah.
Which is just. It's not normal to have that, change, but every time there's a new person, I know how, you started about a year ago, but I don't know, I started 6 months, and not even that long, so then. You're in a learning curve as a new person and everybody else, and yeah, so it always kind of mixes up the basket.
So each of the directors, and these are directors, each of the different programs.
So, the network director, which is our, just for, just for RAzCHOW.
Yeah, for this network, we want to do it. He's a full-time employee for RAzCHOW, and he's the person that's responsible for the.
It's because for me.
It's all of Arizona, but it's a part, it's interesting, yeah, you can have as many partners as you want, and you can have partners that are urban, like the advisory council, but your partners have to be 67%. And all the work has to be in rural, so the advisory council's non-rural, and then you have those things together. Exactly. No, there's a couple of ones. But some of those, we don't have advisory council, I mean, research center, we wouldn't use the criteria. So now we put it together and by because they're important organizations that do really good stuff, but they're not rural, and so we can't get them. And I'm not gonna 66% rural. Like Canyonlands is rural, all of Santa Cruz County is rural. You can go through there, everything's for that. Yeah, all the work is to be done, or And looking at it. That could be, and the co-chairs, there was a co-chair, we don't see it off when. Every time he comes to the one that's been up to. Before play trends and let us one check the block drive.
The RAzCHOW member is satisfied with the development.
Yeah.
You could, you're probably new to place or there already HRSA who was a member or so the wildlife survey is that we can already ever since it started and. But as you know, it's things like, you know, is our education good and what about the leadership? And all that, so you get to answer everything. You need to do it every 4 months. Yeah, she used to do it when I was the director, she was really good at it every 4 months, and then you can kind of compare. Like how the like was before, where the weaknesses are.
So this was during the COVID.
And they have to ride that way.
You have to have.
It's big number. It's like down a lot, so I think. So it's really open in the past year and a conference.
Yeah. Inviting members that were part of the 2019-2020 time.
So are your providers?
That then we switched to Zoom and we were then out, zoomed out, so that
You're
dwindled out and now we're rebuilding.
and you have to apply that way in access.
Right.
You have to do that. During COVID, I'm not very high tech, I'm a generation that, you know, I still sweat when I'm creating Zoom and we got in trouble, or I have to buy the night.
Yeah, by the night guy.
And he was young, she really did try to help us, she knew how to keep us connected virtually.
Thank
whereas
you.
some
Yeah,
directors
thank you.
probably wouldn't do it. But still, it was hard, everybody moved out. Florida.
And I think that also changed the system that we. Right?
No, no, pero digamos que están abajo.
Okay.
Ah, ok, pero por eso.
We used to be. The kid was pretty involved, Tim Russell, his predecessor, was pretty involved, and then Bella? Yeah, no, and then we monthly too. Yeah. You know, and Bella got involved in that CDC grant came in, the COVID one, yeah. Yes, it was gonna happen, like you guys started, those was a huge project, people started getting all that funding. And everybody was like, try reduce CHWs and doing a lot of work to even get on the meetings, right? So it was kind of good, but.
I think it also changed now joint on meetings, where I think in the early stages, there was a lot more CHWs, CHRs. And then you get quarters where it was supervisors that were joining.
Because they were out there. Yeah, so they couldn't join.
So let's see, and now I feel that we're kind of circling back to the pre-COVID. Sort of post-COVID slash.
Yeah, yeah. What is there more than one question?
So that question was, were RAzCHOW members satisfied with the network function activities?
And I think that also then falls under how actively engaged were RAzCHOW members in decision making, planning and evaluation. Because again, it falls under that like pre-COVID, COVID, post-COVID.
Well, it's changed. It's been very fluent. It sounds
Yeah.
like.
Well, and also to give an example for the evaluation plan, our Google had planned to get a draft and get it out to everybody and get feedback and maybe even have like some people that kind of wanted to help more with that, but he ran out of time. And so he ended up just having to do it as best he could. Some of us were involved that are like staff, you know, or supporters to meet the deadline. And he felt bad because he didn't get to get the money, but he was driving up here so much to do outreach in Northern Arizona that he didn't catch it. And so he'll get it now, but someone who said, well, you should have been more involved. You know, the evaluation. The strategic plan, there was a. I was there, the strategic plan, there was a really good subcommittee. But there were several deliberates like March, June, July, they were kind of went like this, and we had it coming.
So I think the part number 2, we can even just put 2/3. Because question 3 is how actively engaged were RAzCHOW members in decision making planning and evaluation.
Number 4, were existing RAzCHOW members retained as active members? I think that's what we just talked about, right? How these are trying to get ones that started it back in. That happened.
I could give some example, for example, some of the new members that wanted to join when we applied for the next grant, which the first one was 3 years, this one was 4 years. Visit Sunita wanted to join, Graham County. Circles of Peace, it was new, and some of them, when they first joined, they joined some calls, but then they kind of dropped out, and I think during that time, there was no network director. And so, like, I went to Desert Meet in September and met with them and did an assessment of what they wanted and stuff, but our doodle didn't start till almost Christmas. So it was kind of like they got involved and then they went off, no, there was just kind of, it didn't quite gel enough.
Just kind of a main question, but what are the incentives for joining?
The information sharing and,
Sure.
getting the technical assistance and, yeah, because the idea is you could be an organization not using CHWs or CHRs yet, but you want to. And or you are, but you want to contribute, you want to train, you maybe very there. You want to evaluate what they're doing, so, yeah.
There's no reimbursement.
No.
Sure.
Yeah. There is a little money in the budget to contract with partners to do special things. And for example, if you said your organization, there is funding in the budget, there always is for the summit. But Kim always said, they'll give it to the advisory council and that's like from the state. So what RAzCHOW does is they just sponsor. So there's $5,000 in the budget. And there's money, like if a certain partner, like say Canyon, as you guys are doing some great thing that other people want to learn about. There's a little bit, there's some money there, contracts with Canyon, you can do some stuff or travel or do a training trust.
RAzCHOW also sponsors members for conferences.
To go attend like APHA and National Health Association, but if people suggest things they want to go to.
So do you think now with the new reimbursement model coming in, this is gonna change a little bit?
Yeah, and see one, like the presentation tomorrow, we've been a lot in our meetings, trying to make sure everybody understands about certification, about access reimbursement, what's happening with Medicare, and all these different things, kind of being like an information resource.
I think as a member that's going to see the transition, one of the things that I know I've really been through the network is as CHWs become the new, or have become the new hot topic. There's agencies that didn't have CHWs before, but now have integrated. So to me, RAzCHOW is kind of like that information hub where this is the space where you could talk with other colleagues about what they're doing, how they're navigating reimbursement, as well as really building partnerships for funding opportunities. I know for CHUD, this is really where we built our personal classes with Canyon Lands, Mariposa, Grant County, WHO. If it wasn't meant for us being part of the network, we wouldn't have that connection.
Those partnerships, so then when opportunities come like, hey, we have a you guys went under an English grant, which was a very large grant. Oh, yes. Things were short, because it was like COVID, right? And then you were ready to apply for that NIH, you already had your own.
Yes, yeah, it's like building your own network, and I think the trust piece is the most important part, because when there's funding, it's like, oh, okay, yes, let's work together for a year, and then kind of dwindles, but meeting every quarter and like interacting, and you're able to keep, those partnerships and those relationships. So I think that's even helpful at that different level of, what the networking providers as agencies.
And help each other, because sometimes you're, I know you're EHS, but say you're some other organization, you might be the strongest organization to apply to send partners, and another time you know what partners are, and then your partner, and you know, a lot of times subcontract and things like that, or even just let each other know about stuff, right? Like, this isn't a good fit for us, but you know what, I think it's a good fit for something, you guys should check this out.
It's a great opportunity to leverage resources and collaboration. Well, I'm gonna make sure that they're
And it might be helpful for the young people initially, we did have some tribes part of the never qualify and never nation officially converted. And then when COVID came and there were opportunities like you all got state money through, and you got the direct CCS grant, you got a lot of funds, we said, you know what? We're gonna back away from that for tribal really with you all unless there's a meeting. But because so many tribal we really want them to be involved in this if they want to, right? Because that's the whole idea of people in urban areas often know the information. And then you're out in a small community, you're saying you wear lots of hats at a small health center or. And then it's like, people really know, yeah.
Or do you want to say rebuilding of existing room?
Like for Arturo, it can be challenging because when he was new, these were some organizations that joined and kind of then became inactive and he never met anything of that. And sometimes he would email, they wouldn't answer, you know, and we finally just make these connections and a lot of times it needs to take the time to go meet them. And then try to find out, well, if there's value, you'll participate. So what does the network need to be valuable to you? What can we change so that you all get involved? Like I think with Desert Sanita, they were already kind of bringing CHWs into the organization together. So as soon as they learned from us about certification, we got all the stuff, it kind of just went and did it. And then kind of dropped out. They did plan to come this time. But, you know, it's something you ask me, how can this help? And maybe it's nothing, somebody's sick, or we have a change in staff members, right? Maternity leave, just all kinds of stuff. Like the Graham County thing. Yeah. So
she's like, we got a crying baby right now.
Yeah.
Can't answer.
Change is always happening, so you gotta keep up with what they're doing.
Were the anticipated number of you members successful in joining?
And actually, that's interesting because I don't think that there's a projection in our communities. I think we wrong. I think we said that we knew that Northern Arizona. The smallest CHW workforce, with the exception of CHR, but a lot of other organizations are working like in Southern Arizona. And I think there's a number, but I don't know, and it's not about numbers, like the network doesn't necessarily have to grow. As long as the members that want to join know about it and can join, right? Because it's not a coalition, sometimes a coalition become like 50 organizations, but that's a lot looser. We're really sharing information, co-chairs.
Say like following versus following.
Yeah. And maybe some members that have joined. It's not, they might say, you know what, it was helpful for us at a certain time, and now it's not where we can put our energy, because they might want to stay on and not be too active. They might want to drop out, you know? There is an MOU, all the members have to sign it. that basically just describes what's the network director's role, what are each partner's roles, what's RAzCHOW's role with the master region, but yeah. But things change. I mean, I can think of things I used to participate in a lot and it kind of dropped down because when I started participating in something else.
Maybe because new members have to come in or rejoin their meetings, it's also providing them the opportunity to take the lead on things. That way you also feel like they're showing up in that work and it's not the same time. Speaking on behalf of the non-members, like their thoughts. And that's also part of the map. As people come in, like, let's provide them this space so that they can like help me there.
I think. Yeah, how would you just going? Here's the actual evaluation plan. There is, it's called the Wilder. We didn't create it. I don't know who's created it, but it's very good for groups. And some of the questions might not be as a good as it is other. That's the evaluation plan. It's not, he's asking about the Wilder survey. It's electronic and our Google sent it out and people respond. It's anonymous. But it tallies, it's probably a survey like you're saying, but it's something that's copyrighted, it's whoever invented it. And it gives you the results, and it's kind of nice because the results come like with a green, yellow, red. The members are really happy, yellow's kind of, and red, these are areas where we have a pretty less work. And then we worked on it.
Okay.
Yeah. It's really, it doesn't take long. For quite a few questions, in 15 minutes, you can go through it. Sorry, but these are all the key. There's something back here that's a lot of it's definitely.
So bad.
They're raging in over here. I saw it.
Yeah, it was like pouring.
Yeah, that's what lightning. Ends up the same.
You know, once you-
I didn't hear it, but I went outside and saw the windows. Yeah, the windows have drops on. So maybe take a note that since he's about to go to survey.
Yeah, just.
Even like a baseline for this year, with members. When you get more people on it, it's almost like the first time they're doing the first.
This is like our big meeting of the year.
No, it's not in that meeting. This is the first one up here. I'm trying to think, this is, we meet in person quarterly. We have one in March, we had one last September, October in person. In person, we're supposed to meet monthly, roughly virtually and quarterly in person. And we've also seen next to Tucson. This is the first time meeting up here, in part because we're trying to encourage membership. And if there were some folks participating, our members like to the city, but they may want to join the gentleman who's going to come. There's a it's called the Care Coordination, Verde Valley Corporation. It's in Sedona, but it serves all of Yavapai County. That gentleman was supposed to come, but his surgery got rescheduled. So you're like, you don't skip that. And you can be waiting for months. So he has to come. His name is Kent. Is Kent the guy from Verde Valley?
Yeah, Kent Ellsworth.
He was planning to come, but he couldn't come.
Yeah.
Because of surgery.
Yeah.
So, but yeah, some people have never done it because we haven't done it. Can we do the Wilder in January?
January, yes.
That's been done since January, so it's been a while. So I think. WILDER, sounds like I needed to do that. WILDER, Wilder and the last name Wilder.
June. Mhm.
June.
That ends in May 30th. No,
July to June.
July to June.
Because
So we start that in July.
July 1 through June, because
Oh, okay,
the cost
okay.
extension was.
Yeah, yeah, you're right, you're right. Yes.
So it would be good, maybe do it soon, because so many people have a bid that have kind of got more involved. So we're just, our building started very before Christmas, right?
Question related to.
If I had, I probably didn't know that.
It asks things about communication, it asks things about, if we're doing what we said we're gonna do, if the members are participating, how they feel about the leadership, decision making.
Members have an idea of the strategic plan.
Well, they should.
They should.
Yeah,
So that's the other thing.
it was just a new one was submitted in March. One was done in the last cycle, and one went into March. There was a committee that worked on it. Everybody received it. But again, you're new enough that you probably have like such a big inbox. But, it sounds like we've been able to say that. Maybe put a note, send out the strategic plan again. And actually, the network has other documents from the last grant cycle. There's a sustainability plan, there's a business plan. We gotta do a bunch of plans. So and the business plan is interesting because that one talks about both business and sustainability, ways to maybe generate income or keep this going or whatever. So
And there's talks about like, do we have a to be part of the network?
or maybe charge, or like say an organization that's not part of the network wants to get some assistance, maybe a small charge for that, free for network members, that's what the grant papers, but maybe be for the service for a non-network member, yeah. Yeah.
Maybe send out important documents.
And some of them may need updated, but at least people would have them all. I think Arturo's very young and high tech. He has everything in a Google
Drive,
folder and everything's in there, but old people like me don't know how to find there.
but not very young.
He has everything in a Google folder, see?
Yeah. And I did share that the Google Drive link within the virtual group as well, and you should receive the notifications and the calendar invites as well, the link for the Google Drive. And everything is organized.
And everything's there. For example, Jill will say, yeah, but I don't know how to do that, and so everybody that's like over 50 will be like, yeah, but where is it?
Yeah, they just ended the group.
Oh, Jill's
the
in there.
red
That's
group.
cool. Jill's in there.
Because they just ended
Anastasia,
the group.
they're probably finishing. What time are we supposed to finish?
10 more minutes, then we have 30 minutes to discuss and present.
Big question. Are we going somewhere tonight?
I was looking around and I think we didn't reserve anything. And
But maybe some people can recommend local, like certain places. Because some people, I think, if they're gonna be here, they might wanna like go out with some others. I don't want to always be with the same people I'm always with. Depends on what I'm looking for, right? But Sam or people that are local could say, hey, maybe, places that have like room or walkable or something like that. Well, I know your dad's here. You brought her dad and sister. Some other folks have that. That sounds great. Are you gonna stay with her?
No.
You have to go back? Oh, okay. Cause it's like,
Stay as late as I.
yeah, it's nice because it's sweet. Yeah. These are just I think, this is just me, but I feel privileged in that I was involved with the networks before this one. Like the Abdella network, Mariposa, the woman, Arizona Roman, the Health Network, which is now the Alliance of Community Health Centers, but I was at the founding network too. And so I'm kind of arguing with that. There are people coming in and what do you mean in that? And so I just think it's be able to describe it well to anyone that might want to play along.
Yeah.
And certainly if I think you have some meeting or something, about, they may not. I do.
Yeah, okay.
Yeah, it's grown a lot.
So you work out of the same.
I live in town.
Okay. So you-
Yeah.
Okay, gotcha.
I lived down in the Valley for 12 years. They created a clinic.
Yeah, check up. Yeah,
So
yeah.
I was part of the design team for the clinic. Made it look like- And now I chair. Everyone else is a native. Most people are native. And then I have right now just one. But, years ago, I actually started. And then it's growing out as a just all friends.
Yeah.
And my son, he's the clinical director. They got here just years, we're gonna grow Sunday, everything's Sunday, everything's Sunday. All the little signs. When I returned that project, she started together, so as a little trainer, it was just like sleep white everywhere. And so I know they keep, she wasn't really. She wasn't. That's like sprinkling and. Well, this was fun. I'm so glad you were able to come. Yeah. She's, you're wasting your age, and you all have health centers. Mojave. Yeah, Graham, Green, so we're. Gila, Duncan and Gila. Hello.
Separate, and then we're over in Beaver Dam.
Right. And then you guys got really great, you opened one in Nevada, so as FQHC, they have to have rules for each state. You guys are brave, hardly anybody else wants to do for the state.
Yeah,
It's a whole different. Your CEO is great.
What's your organization?
Kenya Lands.
Healthcare?
Yeah.
So I hope care.
Yeah, we're a federally qualified list.
Oh, okay.
They're based in Page, and they just. I just live in Arizona like 7 years ago.
Yeah, we have one in Chilchicato.
Yeah.
As well. So we're kind of everywhere.
And a lot of, I think about 30% of your, I did some grant writers. I think 30 or 40% of the patients were.
Yeah.
There's so many others that or live in that area.
Yeah, at our northern clinics, it's even higher.
Yeah, right.
Yeah.
A lot of people work engaged in that right there.
Yeah, exactly. So this whole Contexture thing really interests me because we use Contexture for our patients who may have screenings done through HS.
something that doesn't get submitted through claims data, that's how we close a lot of our gaps. And over the value-based programs as well. So that's how we use Contexture a lot for that part of work. I've never seen it used sort of social determinants before. Super interesting to learn more about them.
Yeah, well, I'm on the board to circle these, and I didn't know they used Contexture. I'm like, there is, and I'm like, really? I don't know.
Wow. Yeah, we use it daily to find screening measures and things like that for our patients. That have said, oh yeah, I already got that done. Where? You know, because it wasn't with us, so we searched HP all the time. Use it for criminal process, social drivers. Never heard that before.
Tomorrow, Anne is gonna present about, I think this the whole new thing, this PCS. Sure, all the different reimbursement things to bring everybody up to date and then how consistent it's been in. A lot of that is actually in either social determinants and health or health related social needs. That's the other way they're saying that. So that's what Anne is doing tomorrow. She's doing a workshop in the morning. I look forward to it. Yeah. She's very sharp. Yes,
That's how I feel most every day.
Yeah, things move.
Tell me more about that.
Yeah.
There are so many things that are constantly fluctuating. It is difficult to keep up on all of the things that are offered and available.
Well, and his organization, for bringing healthcare to like 2 years, 2-3 years to get your guys in right. I get it, but I did the acronym probably every possible way you could do it wrong. Because I could never remember the whole thing, but they're really behind the CHR meeting. And they kind of signed it last year, that was held in Tucson. They're planning another one. So since y'all you would be on the role one of I encourage CHRs that you work with the county or they talk about it. Now this is the first not represented. Yeah, because they're gonna do their own thing, but Rachel, she's been actually, Rachel is very good. She's during the section. Yeah, so, but I don't know if this is. November was last year, and it was really good, and there were folks that were some of the states that had like a switch to the. My only people was there, I think I really like information that to them. But some of the states that came from far, they just feel like they're by themselves and there's nobody like supporting them. Because I just used to really have like the CHR association and different things and there's and I think a lot of CHRs want much teams and they don't have nowhere to go. Yeah. Yeah, I feel like that's what create their switch, which is great. I started, I'll start to you guys had a chance to do it right from the beginning. Everybody else is trying to get it right. They can start from the ground up and do it right. And we're just trying to make it all work. I have like worked with them, but except when you Native health is really the problem. And over maybe it was part of it. He offered that through his ambulance. He helps you and helps to see so much of the refresh. I mean, if they have a question, the world, the staff and they, you know, because they've done it. How to, you know, get accredited, how to privilege with your providers, and then how they're just gonna start building. Something to pull the way, or just start to push the way. Everything's being there.
For the CHWs?
CHWs and primary care. That was one of they started just as a social service organization about 6 years ago. And then they added a wellness department in 2003. And now they just opened their primary care. It's one of their long-term goals. They own their building. The last long-term goal they have achieved yet is every class. Because no matter where we've been, to do like, you know, crafts, sports, cultural things, because they actually take up space for offices. They're doing fundraising, so eventually have some communities that are probably.
Space is one of those. I think that one of those struggles in every rural.
Well, it seems like a building. It's built almost anywhere. It's at capacity, right? That's right. It takes years to get it in. Right? Yeah. Yeah, so native health is because health is so it's slowly, but just right. This is what I just that were doing you know, 13 more minutes.
Okay, perfect, yeah.
I was talking to
Actually, Dr. Molina and I don't know if you know, he remembers me, but we were both subject matter experts for the Echo series for CRC. Oh, seriously? Yeah. Thank you. Thank you. I'm gonna take a picture of this really quick because I fully admit that I am a card. Yeah, so I will let you keep this and I have taken a picture because I will never lose them both. Yeah. Thank you.
Oh, good.
Yeah, now.
We're all gonna be taking a picture of the stairs. Oh, should we go down? Yeah, I think we wanna do it now, before like people start driving the stairs.
Yeah.
Yeah. Okay. Alright. Oh, yeah, we are. Should we tell them how long, like 5 minutes? Yeah.
I think it's before.
I know. For your caffeine deprived brain, you're pretty perky. It's gonna kick in too late, and then you're gonna be like, oh man.
In my defense, I went to sleep at midnight and my husband wakes up at 3 a.m. for work, so that's when I woke up today and I can't fall back to sleep, so it's
I was up at 3:30 East Coast time.
Oh,
I called you.
you want to come join us at the stairs for pictures?
You can. I'm always up.
I lived that life for years.
I kept every year, I was, we're gonna show each one of the changes, so I finally did that. And then I wanted to go. Right through. We saw it, I don't know.
Yeah, I can teach a course. Yeah, we teach indigenous.
Yeah.
Course certificate.
Yeah.
I teach them not medical course.
Sylvia was my boss and she was out there. Last one. And a really nice thing for me, I started with the like, you know, the people tell me that is. And I just learned as I went, right? But years later, I went back as a consultant and a woman that had worked as a CHR. Same desk, same office, same pink walls. She was on the other side of the desk. She had become a nurse. And so, and we're still, she's retired nurse too. But
I tell you, it's good to maintain those transactions.
it is, yeah. Oh, we're supposed to go down the stairs. Ay, estoy quitando eso, que no se caiga nadie en mi computer.
Upstairs in condo now would be a good time to check on you, like. That's why I can't really have Oh, they're doing good now. They've seen the picture. I think we're both from the stairs. We're gonna see if they want me to take one for all of them.
En otra vida era algo. No puede ser que se casualidad. Sí.
I'll shoot you an email tonight once I get back on it.
So we're gonna start with a brief presentation of each group. So please, group one, please stand up and share with the rest of the group. What are your thoughts and your feedback about the questions that you received? Corina and Susan, Dr. Molina, who else? Brenda and Camila. You can choose one or two persons to share.
Corina and I can both do it.
You the recorders, so you're off.
Oh, here they are.
So for group one, we kind of found an overlap on the questions and the themes that we discussed. So for question one on where RAzCHOW's activities started out as a plan. Since in our group, there was a variation between members and how long they've been with the network. Not everyone necessarily knew what were the activities that RAzCHOW was supposed to be working on and that the network members were also supposed to be part of. And we discussed what were some of the maybe challenges for that to happen. And we reflected on in the history of the network, we've had multiple directors who have had many different styles of sharing information, and there might be some gaps in information. And we also talked about how there's been a fluctuation in the network members from people that have been here since 2019 to others that have recently joined, but then also that awkward time during COVID where member participation also fluctuated. And that was kind of the thing for question 2 and 3 as well. So were members satisfied with network function and activities, and were network members engaged in the decision-making, planning, and evaluation of the network? Through the years, things have fluctuated in the involvement of the network members due to pre, post, current COVID. One of the things that we highlighted was that in the early stages of the network, there was a lot more CHW and CHR involvement. And then during COVID, because CHWs and CHRs were out in the field doing the boots on the ground work, it's transitioned more to supervisors, managers being the ones at the table. And now we're kind of transitioning back to CHW, CHRs also being part of the network of visiting. We're existing RAzCHOW members retained as active members, again, back to rebuilding, reconstruction of members of that pre-current post-COVID era. And we're the anticipated number of new members successfully recruited by RAzCHOW. We weren't really sure what the target number was, but we did discuss that it's quality versus quantity and analyzing who's at the table, who's still missing, and that's just something that as a network we should be doing out, and that people's availability changes, network like what people gain from the network also will fluctuate as the network grows. Yes, and so we also discussed things that could help with communication and just for all of us to be on the same page. Sending out a new Wilder survey so that new members or people that haven't participated can have that opportunity to share that information, and also to send out the current strategic plan and any other important documents that might be relevant for our network members to read.
And we're allowed, because our tool has all that stuff in a Google document, but we know that over a certain age, certain people don't know how to find those. I'm in that category.
I am too, so.
Yeah.
Did I miss anything? I'll pass it on to group 2.
Okay.
Okay.
So we're.
I think it's you two really had the most input.
Yes.
Patty and all lot. Okay, so, I don't have the questions, but I'm gonna.
You got it right here.
Oh, you do?
Yeah, thank you. Oh, when they're up on the screen.
There we
go.
Oh, yeah, so you guys are prepared. So a number of new partnerships, how can we measure those? So we were thinking that's kind of straightforward, right? The number of partnerships at the, start of the year, start the baseline, and measure the number of partners that are actively engaged, and that would be where there's some definition, like are they engaged, not just saying, hey, it's partners that are actively participating in meetings, actively contributing resources at the end of the report. Oh yeah, that makes sense to do that. It's kind of like building up, that, the resources for the network. CHR, CHW voluntary certs. So maybe measure the number of individuals who are certified successfully during the first 2 years. And then measure the number of who actually volunteered recertifying. So that'd be something like that. Maybe just, yeah, so maybe that's something we work with you guys on. Like, hey, see how many people actually went through the recertification process and maintained it through the whole first recertification cycle. And then seeing, how many new ones came on over the next couple of years. So I can get something like that. One thing we did mention is that when you compare the cost of recertification for CHR to their annual income versus the cost of recertification for literally every other licensure in existence is insanely disproportionate. Like it's nuts. So I got more than and I did this like breakdown analysis. Literally, getting the health certification is on there. Did the breakdown by the average annual salary, it's way disproportionate for CHRs. So we're curious if that's gonna include CHRs recertifying the cycles, maybe something like that, the extent that it didn't recertify the outreach and say, was the reason it didn't, or working as a CHR, maybe like survey, I'm adding stuff that's going on, sorry.
So you do that already, do something that are easy HRSA to do, an evaluation survey that gets sent out with, my NFP, put that out with, Jen. So we do collect that feedback to find out if there wasn't a template impact.
The barriers. Yeah, because like if somebody's not working this one, they may choose not to be certified just as the cost, but like maybe they would have otherwise that.
Can you resend that out? Because this is the first time I'm hearing about that. Yep, definitely. Yeah.
8, so Patty can speak to this better than I can, but for 8, that was, did RAzCHOW increase the number of organizations eligible and seeking reimbursement for allowable CHW services? So one thing that we were kind of thinking is healthcare claims. So I can get access and track them to see if they are doing this measurement. They very well may be already doing this measurement, but if not, we have a data sharing agreement with them. So our organization may be able to get access to the claims for all the different, 98961 through 98961, 563 CPT codes, that are submitted over like the first, whatever time frame you would like to measure. To see how that's changing over time. Is there an increase in the number of claims being submitted? Is there an increase in the number of organizations that are submitting claims for Medicaid reimbursement in the state? And is there a type of, are there specific types of provider types that are doing that submission? Measures that I was looking at the healthcare claims side of fee for service data and the claims numbers that are coming from the FCOs and actually we have this is on that because it's also a week ago. It's about access to that. And then Patty had a lot of good thoughts that I can't properly summarize regarding the actually fees and policies. So do you want to take that one?
Yeah, so we have, with working with federally qualified health centers, we have quality measures that we have to meet. And so, for example, there's specific codes that are used, and the ones for CHW reimbursement under the voluntary certification are not being used in federally qualified health centers. And so we brought up Canyonlands because when Jody was in your role, one of the things that she had shared with me was how your Nevada was really close to being able to reimburse using specific codes, but of course Nevada laws and Arizona laws are really different, right? And so those are some of the things that we're still trying to get the basis of whether at some point in the future, there's gonna be the potential for the reimbursement model for that type of work that you're doing for value-based contracts, which is very different than community type based organizations.
Yeah, I would like to be part of that conversation. I mean, North Country is a SDHC facility, and we're trying to figure out how our billing process would work with our community health workers. And it's a constant conversation of going back and forth, back and forth. Can we do this? Can we do that? Are we already billing for it when we're not providing services? So North Country would like to be at that.
Yeah, I mean, if you look at any of the FQHCs here and you ask whether they're using those 3 specific codes, they're probably all gonna tell you no, we're not using them at all. But there's other type models that you might be able to utilize, like, for example, I mentioned the fact that if you're doing any type of behavioral health, so there's integrated and then specialty behavioral health, those types of codes under like a behavioral health technician, which could technically be a community health worker might qualify for those services, but at the same time, they're different codes, not specifically those particular codes, but under EHTs that might qualify for some type of access reimbursement. The same thing with like DSME, if you're doing that under the care of a provider, those types of services might be reimbursable. It might be a model that FQHCs could start using too. But we're just not there yet.
But some, as a health plan, some of the federally qualified clinics and other clinics are already doing value-based.
Yeah.
With behavioral health.
Right.
Also, so it includes all that, depending on which clinic it is.
Yeah, but those are different, like those, we all know about those quality measures that we have to meet, that is really different or separate to those 3 codes that.
Yeah, it is.
That, what is it, number 10, right?
Yeah.
Yeah.
It is separate.
Is Katie still on the phone? Yeah. Katie, can you answer number 9 for us?
We wrote you down on our sheet.
Katie.
Oh, yeah, so, okay. Yeah, so number 9 is, RAzCHOW help increase the number of rural organizations with approved CHW training programs. And so, and Floyd or Susan, for all I know, perhaps maybe you guys have the answer to this, but I was involved with Katie and a few other folks that were kind of like a side group of ad hoc committees. Like, for example, we approved Chicanos por la Causa, and there was specific criteria that we had to, or that they had to meet. Were there any more? That's what we didn't know. I didn't know that.
I think there have been some more, and the grant we just submitted a little while when we had to leave the room. We had the number of current training programs in Arizona. I know it's higher than it was like last year, the year before. So RAzCHOW and AZPRC still do that. If any organizations wants to submit their training program for review and approval, you can. It has gone up, but I can't remember how many.
Yeah,
but yeah.
And the real question was, if you want to increase it, how many? Set a target.
Okay, all right.
Right?
Because most of them are not rural organizations that currently are certified. Some are, but I would guess that most are. So, it's not basically a real area.
The Alliance is submitting a training program for approval. That's from Jill.
Oh, cool, okay. So the Arizona Alliance of Community Health Centers is submitting.
So maybe number 9, either reworded or, maybe not even, if it's not. Are you all looking to add rural training programs? Not from an urban area, but actually a rural provider. If you are, then that still holds, but then set a target. We want to, over the course of the next 3 years, we want to have 1 a year or.
Yeah, I don't think it's fun.
Whatever.
Oh, and then the other thing, going back to number 8, did RAzCHOW increase the number of organizations eligible for and seeking reimbursement for allowable CHW services? So the CHW voluntary certification if Access is saying that the only way community-based organizations can get reimbursed, and we can't use specifically, can get reimbursed, is to have the certification, can we remove voluntary, or is that?
Voluntary is in the law.
Yeah, I know, and that's what I was saying, I was saying that, I know it's in the law.
But she's saying as an employer, you can't say that your employee has to be certified.
Employer can if they want.
Mandate.
Yeah,
You can-
employer totally can if they want.
Okay.
But it was made voluntary on purpose because people who don't speak English, people who are not citizens, things that they wouldn't be able to become certified, that's why it's voluntary. In by law in Arizona.
But in order to bill, you've got to be certified.
Yeah, so.
If you think about an organizational level, you have CHWs, you have Naporas, you have so many different verbiage of the title of the individual. In order to actually bill for those services, they need to have that certification, which is not a requirement for their title, whatever they might be.
Yeah, they can still work. They don't.
All right, for that billing reimbursement. Yes, something's gonna happen. We're gonna talk about it tomorrow. And then the last question, did RAzCHOW increase rural CHW use of health-related social media codes among its members? We talked a bit about, you know, how we might be able to tap into Medicaid. One of the challenges will be figuring out how you will track Medicare, which is the next big one. Yeah. Coming down the pike in 2026, 27. The plans will probably start to collect that information and you could get a report, but be thinking about, do you right now get attestations from your clinicians to say, yes, in fact, we did that or something, but I think being able to say anything very specifically about, you know, we generated $6 million worth of revenue in rural for HRSA code. It's gonna be too soon for that, but something you absolutely should build toward, I think. So.
Arturo, did somebody just say
Yeah,
something?
so Gil is saying by law, it's voluntary certification with the state. Voluntary simple means that the state does not require. Access has its own regulations which require certification, and Medicare also requires certification.
Yep. That was a very positive answer. Sounds good.
Access there.
Wait, you too.
Three.
We don't have the poster, but it's also good. 11, did RAzCHOW help design and deliver strategies to recruit and engage youth in the CHW careers? So first thing that came to us is really defining youth, whether it be high school kids, college graduate or college students, even college graduates. These, not just the organization I'm at, but the organizations, we're talking that we had people with their master's degree doing their practicum with us. So really just defining, you know, youth would be, you know, I guess breaking down the measurables of like high school, so number of high school students, number of, college students or postgraduate students. And then, another one we talk about is MOUs, you know, how many are being established in order to get these student workers or youth workers, you need MOUs. MOUs and MOUs, voice. Like for me, I work for a 638 contract site. That Marjorie works for, you know, the National Nation Government, which is a chapter, and those are two separate entities establishing those relationships. Yeah, so that's what we get through, like, and then it's like different strategies, whether it be summer workers or, you know, and finding funding for those summer workers involved. 12, RAzCHOW helping increase the utilization of CHWs and behavioral health integration among its members. That one we kind of struggled with. We really went into, like, for me, I do STI case management. So a big part of our training is trauma-informed care. Make sure we're treating patients right, having the understanding between us and the patients, and then awareness plus education. You know, how many of our patients really know how many resources they have? And kind of like, how has your organization changed their process? Like how many, I wouldn't say like policy changes, but how many points in your process have changed since you've been part of RAzCHOW?
That's really good.
And then 13, the RAzCHOW outreach, technical assistance and training helping increase the number of CHWs employed in rural Arizona. And that's simple tracking, how many number of, you know, CHWs are certified. state of Arizona or the state you're in. And then the type of organization that have been contracted with HRSA. So like, for me, I work for 638, we contracted with HRSA with our CDC, CCR 2009 grant. So we contracted into them and then third party, hosting the trainings and with that. And that's what we didn't know about until we got part of the CDC. So that's the about 14, the RAzCHOW training help increase CHWs in rural Arizona training core competencies and other topics. And that's simply the number of CHWs trained by HRSA. And the last one, 15, the RAzCHOW training helped expand the CHW workforce and address special populations in rural areas across the state. We ran out of time, but this defines special populations. These, like all of us, have different concentrations of what we do. Like for us, we do STI, we don't do a lot of behavioral health, but it is a part of STI case management, or like newborns, mothers, maternal health. We don't have a big part of that, but other organizations, they have to part of that. So for them, that's a special population, or like STI patients. Yes. Like for us, we don't have any programs to do with them. So for us, we see that as a special population, but others, that's for other organizations, that's a standard report. So it's defining that special population. Yeah. I don't know if I'm missing anything.
No, you got everything.
Oh.
Wow. For anybody not aware that, the CHRs are certified in their own system, that's reciprocal for Arizona. It was written that way. If you're certified in another state, that's reciprocal in Arizona. We did that on purpose because we have tribes in more than one state and also CHRs, and so, that shouldn't be a barrier. And I think sometimes people think, oh man, I have to do all this stuff, but if you already show some kind of certification, the state should accept it. So.
I think one thing to kind of follow up with the training is how often trainings are available. Because as staff get new hires and staff turnover, like we're waiting months and months, or maybe if there's only one training once a year. It's the awareness of how often, because I'm going through that right now. I have 3 community health workers right now that I need RAzCHOW, the core competence training.
There's some others here that are waiting too. So, yeah. Are yours self-cert?
Yeah.
Well, thank you. Can we get group 4? And
What were their questions? Oh, rural Arizona.
Okay. Pensamos que las preguntas 16, 18 y 20 eran buenas preguntas. Did RAzCHOW help increase HW integration into both community and clinical teams among its network members? We thought that was a good question. It makes sense to us. Number 8, to put a star. Did RAzCHOW promote CHW retention via advocacy for fair and competitive compensation among its members? We also thought it was a good question, right? The 17.
Oh, I'm just doing the good.
Yeah.
Yes. Okay. Yes, ¿de qué
So,
pensábamos eso?
The 17, we have concerns about these questions. So it says, will the capacity of those who supervise CSWs and administer CSW programs? So I think we can open a window there and ask which capacity. So I think in order to measure and develop trainings for different capacities, because it can be advocacy, financial capacity, it can be different ways. So maybe adding like what kind of capacity or any capacity, and we can also explain more about which ones and which ones. So we can have a like with the answers, exactly. Yeah, which skills, and we can have with the answer what we can develop for the future, and for some organizations develop, I don't know, reimbursement financially, and for other organizations we can build advocacy or any other trainings for that.
Yeah.
So that's the other.
También hablamos de la palabra capacidad en español.
It means training. It means training. So yeah,
Like
or
skills
or even adding a definition in parentheses, what do you mean by this word?
Yeah.
Because if I'm reading it
Yeah.
from my
Yeah, we
Spanish
have a,
brain, like, oh,
we
this
have
is
a hard,
Yeah.
understanding of the question when we're trying
Like,
to
training, no.
translate. So for some people, capacity is,
Training.
and it's capacidad. Yeah.
Yeah.
So,
Capacity is the ability.
Yes, capacity is ability,
La capacidad.
but more like mentally, yeah.
yeah, and also we were talking about, as we have a lot of people, what Spanish is the first language here as a community health workers. So having a plain English is better, is better for some people, and, because we don't want to read the questions like 5 times. So maybe if we have easy words, so all the people can answer better, right? Because if we get the question wrong, we're gonna answer wrong, and just that, we just see that in the question, and yeah, the 17 can open a window to ask for more and develop more trainings or more ways to build capacity in different areas. So, and the
19 is did RAzCHOW help network members prepare their CHWs for leadership roles among its members?
yeah, it was also hard questions.
Yeah. So we understood it as, did RAzCHOW help network members prepare their CHWs for leadership roles among its members, like among itself, or among the members of RAzCHOW? Like among the organization or among its.
Maybe can be within their organization.
It was supposed to be the organizations where they were.
Okay.
Oh, it can be within their organization.
Yeah, something like that.
And
Within
that's-
their own organization.
And also we were thinking about the future to us, the network, if that happened or not.
Leadership roles beyond that.
Yes.
Yeah.
Like to become, take over ASCHO.
Okay, see, so that took a different turn. Because we were like, yeah.
Retired.
Truly laughable.
And then number 20.
Did RAzCHOW help network members develop plans for CHW recognition? It's perfect. That was a good question. Yeah.
Thank you so much.
They raised an excellent point that we've talked about on our calls, which is the development of, for lack of a better term, a data dictionary. So clearly defining, for those of you who work in healthcare, you know about the numerators and the denominators on the performance measures. And the data stewards have to very clearly explain, and everybody's, what do you mean this? What do you mean that? Really getting granular with people and defining it so that everybody knows what they're collecting year after year, and it's consistent, not only what the source is and who's collecting it, but what specifically is it that we're trying to do. So that could be another thing that the team develops and then kicks that back to the group, particularly those questions, because you're gonna know it when you see it, that you know what that means, or you're gonna say, it's still so kick on it, right? In order to get everybody aligned, going in the right direction, y'all gotta be heading down the same path, not somebody going this way and somebody going that way.
I thought was in a group of 6, they all had a different read on the question.
You nailed it. That's perfect, absolutely perfect, and why it's so much better to get everybody's eyes on it.
So maybe having a summary about the keywords.
Yeah.
In Spanish, what the intention of that word is,
Absolutely.
So we can all understand them.
Thank you. We want to open it up to anyone online if there's any comments from anyone still on the Zoom. Or anything else.
You there?
Sachi still there?
Sachi's
Let's put it down.
Yeah, do you want to see the announcement today? Tomorrow?
I can stand in the way of anybody. Here, it's just a flower.
Well,
Okay,
it's,
so we'll go back.
you know, we can leave a couple minutes early. We're gonna come back tomorrow in the morning and Anna's gonna walk us through a lot of the health related social needs, right? About the codes and other fun capacity.
Make your head training.
Yeah. So, yeah, thank you, everyone. We have breakfast at 8, right?
Yeah, we have breakfast at the, and at the same time, we're going to start with, right? Ann?
Yeah.
Yeah.
And we'll go from there. So, everyone is coming tomorrow?
Yes.
Perfect.
Okay.
Yeah, same room.
Tomorrow.
Yeah. And please be reminded that the hotel provides breakfast earlier tomorrow.
Here?
And the hotel for anyone that is Jordan. But the breakfast will be served here as well. Like the-
What do you have? Double breakfast?
Actually, will be better here.
Somewhere like.
There might be some Contexture that we're talking about that might be challenging to translate from maybe Erica and some others. Or decide how they want to translate some of what you're gonna say. Because
If we had the handouts, I could do it from an advance.
Yeah, it's gonna be
Yeah,
kinda
we're
hard.
going to provide handouts, whatever you want to.
anyway, just a thought, that she might have some technical. terms
And
about
stop me
reimbursement.
at any point in time,
Yeah.
just stop, me, you know,
Dr. Molina, you have something?
yeah.
Do you have something?
Good point, Jeff.
I thought you were going to.
We're just.
Okay. Perfect. Well, thank you so much and see you all tomorrow. Thank you.
So her stuff is here.
Yeah.
Her stuff is here, so she's.
She has the key to my.
So their future, they don't want to. Yeah. Working on a really great.
Yeah.
Strategy, being there. For which.
Yeah. Yeah. We enjoyed visiting. Yeah, then I'll bring my contact card. That'll be- Yeah. Thank you.
Next to Ivan.
Major League, what are you doing tonight? I'm gonna check with my son and my grandson to hear. My son lives here.
Oh, nice.
I'm gonna see if we're, going out to dinner or not.